Good morning, everyone. Happy Lymph Day. Thanks to everyone who's already been checking in. Happy to be here with you today. Good morning, good morning. Good morning, Raquel. Happy Sunday. Good morning to everyone. I don't know what the weather's going to be like here today, but so far it seems like perhaps it won't be super hot, but I don't know. I haven't checked my weather app for Vista today. Good morning, sunny here. Oh, Corey's in Solana Beach. Well, it says that Vista's not going to get over 77, and for me, that's great. For me, 77 is manageable without putting on the air conditioning. So awesome. Well, it's good to see all of you. Thank you for signing on. Good morning, Gabby. Today is Lymph Day, one of my 3 favorite days to teach, and I'm excited, especially for there are a few of you that were just in lymph class with me. Yes, good morning, David. One of my favorites, my absolute favorite is nervous system, but I love muscle contraction. I love all those things that, you know, we see on the table. We see how we're affecting our clients. And if you just took lymph drainage with me, you learned how you can move somebody's lymph in incredible, fast ways. So, so we really like that. So before we get into our lesson this morning, is there anyone that needs to or wants to retake the midterm that has not done it yet? Anyone that would like to retake the midterm, wants to retake, or miss the midterm? I don't really know. I haven't looked at, I know Dan's in the background. Good morning, Lupe. I know Dan's in the background right now, and I don't know if we have anyone who missed it that hasn't taken it yet. Yeah, just let me know. I know that Mindy went over all your points with you. Yes, I did, but maybe I can retake to get a higher score. What score did you get? What score did you get? And I will check. All right, how much of your homework have you turned in? So I'm not using people's names, guys. So if you need to communicate with me right now, well, missing 2 weeks doesn't affect your score. But if you miss 2 weeks, you'll want to start working on your ABMP quizzes to make up that time. Are you financial aid? And is there anyone else who has got some attendance issues? Let's get them worked out right now. You are financial aid, so you need to make up at least 10 hours that you can do with ABMP quizzes. So do you have ABMP? Okay, I would put your energy into that. But of course, if you want to take the midterm again, I'm writing your name down and we can send you a link to do that. How about your homework? Have you turned in all of your homework? So you didn't turn in the homework when you were gone. Okay. Okay. Well, the first thing I would do, you should know how many hours that you've missed for those of you that are asking me that. You're the one, you know when you were absent. We can certainly look it up if you honestly don't know. I have about 160 points, not sure what the points are up to this day. Wondering if I need to do extra credit. Okay, I'm gonna check on that during lunch. I'm writing your names down. Those of you that are asking me. So for the student that missed 2 weeks, what you really want to put your energy into is the ABMP quizzes. And if you look on your syllabus, it's very clear about what categories you can take the quizzes in. So that would be anatomy, physiology, pathology, or kinesiology. You do not have to pass the quizzes. The quizzes are for practice. So that's what they're for. You don't worry about your score. For the person asking me, how do we know how many points we have thus far? If you were here last Sunday, Mindy went over everyone's points with them. If you were absent last Sunday, then I can help you with that. I'm not sure if Dan is in a position to help.
I'm kind of going through line by line and
okay.
answering as I go. So
thank you. Do you have the time to do that, Dan?
Sure.
Okay. So Dan is going through those of you that don't know your points.
Or hours.
Or hours. Well, then you must, so for the person that said you were there last Sunday, then you probably didn't ask. So Dan is working on that right now to give you points. Remember, you get 10 points for every completed homework, meaning both the coloring and the written assignment. You get 10 points. We don't accept late homework. So Dan is going through it line by line. If it comes down to you not passing the class because of points, you can either do extra credit project, or I will, sometimes we accept late coloring. All right, so extra, so I just had a student ask me to do extra credit. Would you like to do sight, taste, hearing, or smell? You okay, so Ruby, you want to do taste, do taste. Okay, thank you. So it's just about 10 minutes. You can do it in any way you want. You can do oh, wait a minute. Oh no, someone else asked for taste. Ruby, what do you want to do? You want to do sight, hearing, or smell? No. Okay. All righty. So I'm going to go ahead and mention your names with the extra credit because your co-students are going to know. So Ruby's going to do smell. I love this. And you can be as creative as you want. And Alexis is going to do taste. You can be as creative as you want. You can write a song, write a poem, do a PowerPoint, video presentation, anything. You can have fun with it. It's about 10 minutes, maybe, yeah, 10 minutes. And all you're trying to do is you're trying to teach your classmates about the sense of smell or taste, maybe some anatomy, maybe some physiology, and maybe some pathology. So pathology is how the sense gets sick. You know, maybe losing your sense of smell or taste, or tinnitus in your ears, anything that teaches your classmates. But you can have fun with it, be creative. If you're artistic, we've had people make puppet shows, and if you want to do something like that, then you just have fun with that. Okay, so for all of you that are asking about homework points or attendance, Dan is going through line by line and answering you. So if you just hang on and be patient, he will get to you. All right, if you missed 2 weeks of homework, that's 20 points that you did not receive. So if you do all the rest of your points, then you would have 80 points plus 75 you got on your midterm. That's 8 and 7 that's 155. We still have 2 more homeworks due, so that would be another 20. That'll bring you to 175, which means you have to get up to 240 points. The extra credit is worth 25 points. And again, you can have fun with it if you have the time. Okay? So if you want me to sign you up for extra credit, I can do that. And I'm going to give this about 1 or 2 more minutes before we start our lesson. All right. The messages have pretty much slowed down. Okay, Joanna, what would you like to do, sight or hearing? Sight. Okay, this is exciting. That means we have 3 extra credit projects that are going to happen on the last night of class, and it'll make the last night so much more fun. So I'm excited. Thank you. We still have hearing. If anybody wants to volunteer to do hearing for extra credit. So, so I'm pretty sure Dan will probably put those next to your name on our homework.
Shoot, you know what? I didn't record them. So if
I've got them.
You've got them, but
I've got them, Dan.
You put, what you're doing in the question panel, I'll put it in right now. But also, I just cleared my question panel, so if anybody needs any more information as far as questions on homework or attendance, I'll answer it now.
Okay, so do you know at this point, will I need to do extra credit if I have 167, including this week's homework? Well, you have 2 more, so write it down. You have 2 more homeworks. So you have digestion and endocrine. That'll give you 20 more, which is 187. And if you minus that from 240, that tells you how much you need to get on the final. Okay, so that's the formula. Tells you how much you need to get on the final. So you make a decision whether you want to do, Joanna, for the 3 people who've signed up for extra credit, it's due the last night of class. After we do the endocrine system, we'll do the extra credit projects. So the last night of this class is September 14th. Dan, you have someone there that was waiting or just asked for points?
I see, I'm on it.
Okay, you're welcome, June. Yes. All right. Are we almost ready to start our lymph lesson? All right, let me shut my door so we won't hear my family. Okay, I'm going to give it 1 more minute for Dan to answer these questions, and then we'll start our lymph lesson. So if you need to run to the restroom already, like I do, go ahead. Okay, so a few of you are communicating with Dan about homework issues, and Dan will figure that out. And we're going to get started on lymph.
Yes, hopefully everybody has their questions answered. If not, ask again. So you're good.
Okay. All right. So we're talking about lymph today. So lymph naturally comes after the circulatory system because basically lymph is the water of your blood. So it's the water of your blood just in a different location. It's that easy. We can be done. Good lesson, guys. Good day. Just kidding. Just kidding. All right, I'm going to close my question box and get started with the lesson. Yes, David, wouldn't that be awesome? Done all the homework and have 98. Okay. Thank you, Raquel. I'm extremely enthusiastic. So I use this quote on my lymph book that for those of you that took lymph with me the last 6 weeks, 5 weeks, natural forces within us are the true healers of disease. This was said by Hippocrates, the father of medicine. Hippocrates had a real, he had his finger on the pulse of health. That's for sure, especially when you look at, he actually predicted that in some way in the future we would have a type of medicine called homeopathy, because he was all about likes curing likes and not opposites curing likes. And so anyway, for those of you who might be interested in homeopathy and you are in Kearney Mesa or San Diego or Escondido, my homeopathy class was just added to the schedule as a 20-hour class, a Monday, a Friday, and a Monday. So if any of you are interested, I'll be teaching you a very abbreviated course in using homeopathic remedies for first aid and acute diseases like the flu and earaches and stuff like that. Naomi or Raquel is saying we use that for decades in Brazil. Yes, all over Europe and all over the world they use homeopathy. It's the United States that poo-poos things that like that. It's October 3rd, Monday, Friday night, October 7th, and Monday, October 10th. So, and I can't remember if it's Kearney Mesa or Escondido, but those are only 20 minutes apart from each other. So hopefully some of you will be able to come to that class. It's a lecture class, but we have fun. Okay, so let's start with our definitions. So lymph fluid. So this vial is the only picture I can find that looks anything like intestinal lymph. So lymph is simply the fluid that's contained within a lymph vessel. So from the moment your interstitial fluid, which I'll describe to you what interstitial fluid is in a little bit, the moment your interstitial fluid enters a lymph capillary, the entire time it's within a lymphatic vessel, we call it lymph. It is normally clear to yellow, depending on how hydrated you are. But around your small intestine near the end, one of the functions of your lymphatic system is to pick up dietary lipids, fats, and lipid-soluble vitamins. And when those fats are and lipid-soluble vitamins mixed with your lymph, it turns the lymph milky white, like you see here. So in the first autopsy that was in the first years of doing autopsies, the arteries and veins coming out of the small intestine were called milk veins because there was a milky white fluid. So that's why this picture is the way it is, because if you just look at a glass of water, that's pretty much what a healthy lymph looks like. And this is also healthy lymph because it's carrying your fats and fat-soluble vitamins. So lymph pretty much contains everything your blood contains except for the red blood cells. So it contains white blood cells and all kinds of white blood cells, proteins, fats, water. It can carry oxygen, nutrients, carbon dioxide, waste, bacteria, viruses, anything that your blood has in it, your lymph could have in it. We have different sizes of proteins in our blood, and the larger proteins stay in the blood, and the smaller proteins leak out and go throughout the lymphatic system. So anything that your blood can contain except the red blood cells is what we'll find in your lymphatic system, because I'll repeat what I said in the beginning, is lymph is simply the water of your blood outside the blood, getting cleaned and filtered and monitored. It's getting monitored. And it's getting monitored by your entire immune system. But this is just one part. Your lymph is just one part of your immune system. So a lymph capillary, let me look at the next slide. All right, so lymph capillaries are always found near blood capillaries. Now I know I'm going to go to the next slide and then I'll be back to this one, so don't worry. So we looked at a picture a lot like this last week with blood capillaries, capillary beds, where the blood goes from a larger artery to an arteriole to a capillary to a venule and eventually back to a vein. Okay, so in what we didn't talk a lot about last week is that your blood capillaries, we did talk about it. Your blood capillaries have little holes in the walls, and every time your heart beats, a percentage of the fluid of your blood, the blood plasma, okay, a percentage, anywhere from 10 to 30% of your blood plasma leaks out into what we call the interstitium, and we call it interstitial fluid. So we're gonna, all of these little droplets here, okay, is your interstitial fluid. Everything in your body is hopefully is wet all the time. When we our interstitial fluid bathes all of our body tissues, our cells. Interstitial fluid is what brings our nutrients and waste inside the fluid to our body cells, things that need oxygen and nutrients. Interstitial fluid is what we're trying to, when we talk about the piezoelectric, remember when we talked about piezoelectrical, and when we deform collagen, we create a negative charge that we're sending through our interstitial fluid to bring healing throughout our body. We also send it through the ground substance of our fascia. And so our interstitial fluid is extremely important in carrying our nutrients and oxygen and healing messages to the cells of our body. Well, that fluid comes originally from capillaries. So if you picture in your mind, every time your heart beats, the capillary walls allow, from the pressure coming from the beating of the heart, the capillary walls, through the capillary walls, your blood plasma is pushed out into interstitial spaces, and that's what we call your interstitium. So this is all fluid, okay? All of this surrounding your capillaries, your lymph capillaries, which are these green ones here. All of this is your interstitial fluid. So when we become dehydrated, other things suffer because we need to have fluid bathing all of our cells. So we get dry skin or constipation because those systems can do without the water. It's not going to harm us in the short term. It's so we have a lot of this interstitial fluid. So that being said, I'm going to go back to the lymph capillary, and I need to make a note to move these slides in lymph, which is not a big deal to get back and forth. So now that we understand, now we're looking at the actual lymph capillary, which is these green ones right here, okay? So we have blood capillaries. Every time the heart beats, water or plasma squeezes out. It's a very high pressure system, so it only pushes water out. And with that plasma, it pushes nutrients and oxygen in order for it to float through your interstitial fluid to get to your body cells, okay? So now lymph capillaries are just sitting there waiting. Okay, they're waiting to do their part of the job. They're part of your immune system and they're part of moving fluid. Okay, so this is a lymph capillary. And so the first thing we see here is that it has a blind end, meaning it has a beginning. Whereas blood capillaries, okay, when we look at blood capillaries, they're just a continuation of another blood vessel. Okay, capillary, 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 and then we go into a venule. So you can see that this capillary bed here is just a continuation of other vessels. Remember, artery, arterial, capillary, venule, vein, that order never changes. Well, that's where we find capillaries. It's called a capillary bed. So we have fluid being squeezed out in capillary beds. So lymph capillaries, this is where they begin. Most of the lymph capillaries in your body are at the junction of your dermis and your epidermis. So very, very superficial, okay? And they start as just this blind-ended, they're the beginning of lymph circulation is your lymph capillary. Okay, so they're found near blood capillaries, of course, within the interstitial fluid. And their job at this point is to drain that interstitial fluid. Because if you think about it, every time your heart beats, 10 to 30% of the plasma, which is the water of your blood, pumps out of your bloodstream and into interstitial spaces. And now we call it interstitial fluid. Well, these anchoring filaments, can you see these little connective tissue strings? Okay, connective tissue strings here. As the pressure of the fluid builds up around the capillary, the pressure of the tissue pulls on the strings, you can see down here, pulls on the strings here and opens the walls of the capillary, and this interstitial fluid that's waiting outside just kind of flows right in because of the pressure change. We have no fluid in here right now, but the building up each time the heart beats, the building up of this pressure pulls on the anchoring filaments and fluid flows in. And when the pressure gets the same between the outside and the inside, then the capillary walls of the lymph capillaries close. And now interstitial fluid is now called lymph fluid. So the birth of lymph fluid is the water of your blood, which we call plasma. It leaks out through capillaries. It leaves the red blood cells behind, which is why it's clear, okay, clear to yellow, depending on how hydrated you are. And then it flows with it. When it flows out of the capillaries, it's full of nutrients and it's full of oxygen. And those nutrients and oxygen just start flowing off, swimming, so to speak, swimming off to places that need oxygen and nutrients. That interstitial fluid builds up because every time the heart beats, a little bit more is added to the interstitium. Okay, the reason we don't swell up is because lymph capillaries are there to open up and accept and drain. This is what we call draining interstitial fluid or draining interstitial spaces, because they open up and they drain the interstitial spaces. So this is a constant flow of fluid from your blood capillary to your interstitial spaces to your lymph capillary. So in the blood, it's called blood, okay, because it's mixed with red blood cells. If we take the red blood cells out, it's called plasma. So when that plasma leaks out, we call it interstitial fluid. When the lymph capillary picks it up, we now call it lymph. And it will be continued to be called lymph until it rejoins the bloodstream just at the right side of the heart. It's going to go through a very, well, depending on where it becomes lymph fluid, it could go through a very short journey to the heart, or if it starts in the foot, it can go through a very long journey to getting to the heart. And that's where it's moving through the lymphatic system and getting cleaned and concentrated and checked by your part of your immune system that lies within your lymphatic system. So for those of you that took lymphatic drainage, you already know this, but for people who didn't take it, what we do in lymphatic drainage is because these capillaries are at the level of the dermis and the epidermis, which is just paper thin in some places under the skin, we stretch the skin so that we manually pull on these anchoring filaments, and we open the walls of the lymph capillaries, and we invite the lymph fluid to come in about 4 to 5 times, maybe up to 20 times faster than it does on its own. Okay, so that's the purpose of manual lymph drainage, because we are manually opening up the lymph capillaries by stretching the skin at a particular depth, and we invite that fluid in. This all learned in lymph drainage class. I can't wait to take it. Yes, June, this was. And are you an Escondido or a Kearney Mesa student? Good, because I'm teaching it your way November, I think November 5th through December 3rd. Saturday day. Yes, Saturdays. Yes. Yes, I'm teaching lymph drainage for 5 Saturdays. Oh, good. Samantha's going to be there. Yay. It'll be so fun to meet you guys. It's really fun to go from anatomy online to live classes and meet you. You know, I can't remember, Santali, if it's Escondido or Kearney Mesa. I can never forget, but they're only 20 minutes from each other. So hopefully it'll work for you. But yes, that's what manual lymph drainage is. Oh, Samantha says it's Escondido. Thank you, Samantha, for reminding me where I'm teaching, because I didn't know. Escondido. All right. So does anybody have any questions about these 3 slides? What interstitial fluid is, what blood plasma is, or what lymph fluid is? Does anybody have any question, not completely understand it, before we move on? No? Okay. All right. So now we're going to talk about lymph vessel. Not unlike blood vessels. In fact, lymph vessels probably have the most in common with veins, because if you remember in the veins, there's a backflow valve. Okay, there's a backflow valve that keeps your blood that's in your veins from moving backwards, from falling down into your feet or your hands or the base of your trunk. So lymph vessels are simply hoses that carry lymph. So way up here, we have the lymph capillaries, right, at the junction of the dermis and the epidermis. And then as soon as all those capillaries branch into lymph vessels, we can see that the structure here changes a little bit, okay? Changes a little bit here. We have these beautiful little hearts. They're called lymphangions, okay, which is French for lymph heart. And they are actually contractile units of all lymph vessels, except for capillaries. We've seen what a capillary, I'll come right back. We've seen what a capillary looks like, okay? We don't have any contractile units in here, but we see that we have the beginning of one here in the pre-collector. Okay, so here we just have open walls, and then we have open walls, and we go into our first pre-collector. So that's what we're looking at here. Is a pre-collector, and these are all in the dermis, right? These are all in the dermis, and the reason we stretch the skin up here at this level is so that we can open those those anchoring filaments and invite the lymph in. So under normal, healthy bodies, okay, once the lymph capillary empties into the pre-collector, that's where your lymphangions they're already beating, okay? They're surrounded on the outside with smooth muscle. And when the lymph enters a little lymph heart, that causes the smooth muscle to contract, okay? I'm going to try, oh no, we're already in the webinar. I can't show you. I'm going to find a video that Mindy can show you on Wednesday night of an actual lymphography where you can actually see the lymphangions beating under X-ray. So they beat about 6 times a minute, and once they beat, once they contract, they're pushing the lymph into the next lymphangion, and when it relaxes, it is drawing the lymph from the last lymph heart. So it's a wonderful little machine that contracts about 6 times a minute. But we can see now through X-ray lymphography that when we do lymph drainage, we can get that moving up to 25 times faster. Now, it also increases its speed with massage, that is for sure. But the difference is that when you're doing massage, number one, there's a few times in the body where we're massaging against the flow of lymph, because lymph doesn't always flow the same as blood. And then there's the, if we're moving blood and lymph at the same time, we may not really be changing the ratio. We do lymph drainage for people who have swelling, maybe lymphedema or edema. So when you do manual lymph drainage, you are simply increasing the flow of lymph, which is sometimes that's all we want to do. We don't want to also influence the blood. We just want to influence the lymph. But we know that massage moves lymph as long as we're pushing in certain directions. Because sometimes lymph flows the opposite of blood, and you would have to take the lymph class to learn where those places are. Okay, so lymphangion, hoses that carry lymph, they contract normally about 6 times a minute, but we increase that with lymph drainage and massage. And we have lymph hearts all the way till we get back to our heart. So with lymph drainage, Miriam, it says that we can increase it up to 25 times. We know we increase it with massage, but that's not been studied as much as it's been studied just doing lymph drainage. So we definitely increase it with massage, but we know with lymph we can get it up to 25 times faster for a very short period of time, but still we are increasing it. Okay, lymph nodes, and I have this great picture here of an X-ray showing lymph vessels connecting to lymph nodes, connecting to vessels, and connecting to more lymph nodes here in the groin. So lymph nodes are bean-shaped structures, bean-shaped expansions of your lymph vessels. We have between 600 and 700 in the body, and half of those are normally located within the abdomen and the chest area, meaning around the organs, the heart, the lungs, your intestines, your large intestines, your liver, your spleen, your pancreas, deep, deep, deep around all of your organs. Half of your lymph nodes are located in that area. Okay? So they contain B cells, T cells, and phagocytes. Those are all, 3 of those are types of white blood cells. And we're going to talk about their functions in a little bit. And let's see, we're going to look at where lymph nodes are located on another slide. Lymph nodes can be anywhere from the size of a pencil eraser to a small or medium olive. There are various sizes. You have the afferent vessels bringing the lymph in to the node, and we have the T cells that are in and around the outer sinuses, and then we have B cells that are located within within the center of the lymph node, and then this is where they're getting filtered, and then we have phagocytes, and we're going to talk about what all those things do. Okay? Okay, so on this slide, we have leukocyte and lymphocyte. So we're going to start with leukocyte. Leukocyte is the umbrella term for all white blood cells. Okay, all white blood cells. And we find white blood cells all throughout your body, in your blood, in your lymph, in your interstitial fluid. We find them in connective tissues. We find them everywhere. Okay, so, but a subtype, like a category of white blood cells is our lymphocytes, and those are your B cells and your T cells. Okay, so under leukocytes, we have macrophages, phagocytes, natural killer cells. We have all your white blood cells that deal with allergies and sensitivities to things within your body. But your subtype, the ones that we're going to be talking about today, are your B cells, T cells, macrophages, and phagocytes, because they're the ones that are really the most active in your daily life, your daily patrolling of your body, looking for anything that doesn't belong within your body. Okay, natural killer cells. Everybody's on patrol. Everybody's on patrol. Okay, but they're all throughout your body. There isn't a system in your body that is not a part of your immune system. I'm going to give you a half a minute to finish writing this down. All righty. Okay, so we have three definitions here that all go together. So an antigen, if you break the word down, it means anti or against, and genesis means life. So against life, anti-gen. This is an umbrella term for anything that begins an immune response. Okay, anything that begins an immune response. Two specific words would be pathogen. Pathos means suffering, and that is anything that causes, a bacteria, a virus, parasites, bug bites, anything that causes you to have a kind of a disease process, a suffering process. The word comes from pathos meaning to suffer, and allergen, which is a hypersensitive, what we call a hypersensitive response to an antigen, something that most people do not normally have a reaction to. Okay, they don't normally have a reaction to. So how many people have allergies? Okay, lots of people, only in Texas. I love that. Some shellfish, many, somebody has many. Who else? Anybody want to name it? I'm not using your name. Chronic hives. No allergies here. Cat dander. Seasonal count, yes, it does. That is hay fever. No allergies with Raquel. Oh, sorry. Shrimp. Here's another shrimp. None. Good. Dust and dogs. Oh, well, I'm afraid you can never come to my house because it's dusty and there's dogs. All shellfish. Yeah, that's becoming more and more common. So thankful to have no allergies. I had an allergic reaction to a shrimp once, but never again. Awesome. None. So we have a real mixed bag. Sometimes people have air allergies. On my intake form from ABMP, when you start seeing clients, it's really important to know if people have allergies, because I have a client with who's allergic to chamomile, which I think is in the ragweed family. And so we used to use this beautiful called chamomile blue massage oil in my practice when we first opened. And it's good to know when somebody has, a chamomile allergy or a eucalyptus allergy, because so many times products that we use could have eucalyptus in it. And so making sure that your massage intake form asks if they have allergies. And when I get to the allergy part, the first thing I say is there anything you could think of that would possibly be in my lotions or my creams that you could have an allergic reaction to? So that's kind of where it becomes important. Some people have multiple chemical sensitivity, and you can't even use aromatherapy with them. And so you would want to make sure you had lotions and oils that were not scented. I never scent anything I have. If I want to use aromatherapy with someone, I put the 4 or 5 drops in my hand and I mix it with my lotion and then put it on the client's body. So getting a whole host of scented oils or lotions is just not practical, because if you end up studying aromatherapy, then you're going to want to use it for the therapeutic uses, and you would want to have the essential oil in your practice and then add it to your lotions or your oils. So not sure if you've heard that concept yet from any of your teachers, but since we're talking about allergies, then I will bring it up then. Okay. All right, it's 11 o'clock, so we're going to take our first little break and go stretch your legs until 11:15. And yep, go ahead, take a break. And I'll see you in 14 minutes. Okay, welcome back. Hope you had a good break. We're going to get right back into our presentation here. Anybody have any questions? Thanks for checking in. Back from break. Excellent. Thank you so much. Thank you for checking in. All right. Hello, hello, hello. All right, antibody. Antibody. So antibodies are formed by B cells, okay? That's one of our jobs of our B cells is to form antibodies, and we'll talk about how they do that in a little bit, but it is, an antibody is a protein that's produced specifically by the immune system, by B cells, that will attack a specific invader. So they're very specific to what it is that they are going to attack and attach themselves to. So when you have an illness, any kind of an illness, eventually your body makes antibodies for that illness so that the next time you contract that same illness, hopefully you have antibodies that are going to help you automatically or in a more efficient way fight that illness. When you get vaccinations, what the vaccination does is it creates antibodies to that illness. So if you get, your childhood vaccinations or tetanus vaccination, it's a small amount of either the live or the dead virus, or live or dead, whatever it is, that creates a kind of like a secret immune response in your body, so that your body will make the antibodies that it needs to fight that illness. But the things that we don't think about every day is that if we eat an apple, if we put on perfume, if we put on lotion, when we come in contact with anything, either on our skin or ingest it, our body has, our immune system does have a response to it. Now, we don't notice the response because, number one, the apple isn't making us sick, or the clothing we're putting on, or whatever's coming, the perfume or whatever's coming in contact with our skin doesn't make us sick. But if you're someone who, let's say, has an allergy, and let's say you have a contact allergy, well, then your body starts to make antibodies against that. And one of the things that can happen is hives or itchy skin or a rash. That is your immune system trying to protect you from something that it feels is a danger to you. Okay, so we can do antibody tests. Like, I'm sure everyone's learned about antibody tests since COVID has been here. And we've had COVID vaccines, COVID boosters, COVID variants, people who've had COVID. And we're still learning about how long once our body makes antibodies, we're still learning how long we might keep those COVID antibodies in our body. I'm still not sure if we're sure, but for those of you that have had, let's say, chicken pox, like if you're around my age, in your 60s, then you most likely had chicken pox because they didn't have a vaccine back then. Those antibodies are still detectable in my body. That you can see by a blood test, if you're looking for it, that I still have the antibodies to chickenpox or the antibodies to measles or mumps because I had all of those diseases. Usually antibodies last a good portion of your lifetime. Now I understand with a tetanus shot, they want you to have a booster every 10 years. I'm not sure why. I just wait till I get injured before I just go volunteer for a vaccine. But that's what antibodies floating around in your blood are indicative of diseases you've had, things you've come in contact with, that your body created an immune response, made antibodies, and those antibodies go into action when you are reintroduced to that illness again. So I had COVID in May, and the rumor is that my antibodies will last about 9 months. Well, I'm not sure anybody really knows that for sure. So June, July, August. So I should be out of my cycle supposedly of safeness from getting COVID again. And so it's time, and I don't know if that's true. I mean, you can certainly go, it's called getting a blood titer. I'm pretty sure you spell it Titre, a blood titer. I'm typing the word to you. It might be Titer, but that a blood titer is going to show what antibodies you have. Or you can just get an antibody test for COVID. It is just up to you. I know that my son has done it for my grandson because he's too young to get a vaccination. All right, so I'm going to move slides if there's no other questions. All right, so we're going to talk about a particular type of white blood cell called a phagocyte. So the picture on the left is of a phagocyte. It is a cell that eats antigens or cellular debris. They're on patrol, and the process of them engulfing or enveloping or eating is called phagocytosis. So cytosis is like cell death or cell ingestion. So this is the process of a phagocyte eating antigens. I picture them like little Pac-Men, just kind of going through your blood, your interstitium, your lymphatic system, your connective tissue, everywhere you have body fluids, and they're just roaming around looking for things to eat. So they could eat cell debris, they could eat antigens, they can eat dead viruses, they can eat just about anything. And when they die, then whatever they've eaten goes with them. And part of what is filtered out in your lymphatic system or your digestive system when you defecate or urinate, those are ways that the body gets rid of these dead cells and debris by the process of elimination through our elimination system. So phagocytes are pretty happy little cells. I mean, their lifetime is about eating, and they probably never have to worry about gaining weight. They can just eat whatever they want, and, they just travel around and eat stuff. Okay, and they process it, they analyze it, and they digest it and kill it. Now, a macrophage is a bigger phagocyte. Okay, this is a bigger, and they are usually called antigen presenting cells, because what they'll do is they'll perform phagocytosis because they're a macrophage. They're a type of phagocyte. They're just a bigger one. And they kind of patrol around, and they might see the antigen. The antigen could be a virus or a bacteria or a fungus or a parasite or anything that, and it could be yourself. And, in the case of an autoimmune disease, this macrophage can be taking a bite out of your, let's say you have MS. It might be eating your myelin sheath. Okay, it might be eating chemicals in your body that you need. So, when the immune system goes awry into an autoimmune disease, it means that our white blood cells are starting to attack ourselves. So macrophages, what they tend to do is they might see something really big and take a bite out of it. They're like, I don't know what this is, but I need to figure it out, and I need a T cell, because T cells are ultimately in charge of the immune system. And the phagocyte digests the enemy, the antigen, and breaks it down into small fragments. And then it's almost as if on the cell wall of the macrophage, it's almost like a tattoo or an extension shows up on the cell wall of the macrophage, and then it releases chemicals, because what it's trying to do is it's trying to find the T cell that's going to let it know, what am I doing with this antigen I found? What is it? A bacteria? Do we just need a local warfare of white blood cells? Is this a virus and it's going to go crazy? But the macrophage cannot decide that on its own. It needs to have a chemical conversation with the T cell, the helper T cell, that will know how to handle this. And at that point, when it does find the T cell, the T cell might decide, it's not a big deal, or, we have antibodies already for that, or we need a B cell to come make antibodies. But this can take a couple of days, which is why when you get a common cold, a flu, even COVID, and depending on how many, whether you've had no vaccines or all the way up to 4 vaccines because you've had both of your boosters. And I know everybody is different, and our job here is not to really talk about that so much as to just make comparisons. But so that's why it's called an antigen presenting cell. It's gonna just patrol, but it can take a couple of days. This is why your body has a fever. This is why your body makes mucus. This is why your body has a cough. This is why you get fatigued or tired, because something has invaded, and it could be a macrophage that's just floating around and just trying to find that T cell, okay? Trying to find that T cell that's going to let it know what to do. So it could take a couple of days, which is why, you get a flu, you get a cold, you're down maybe with a fever, body aches, fatigue, maybe some mucus coming up or a cough or your eye, whatever it is, because whatever is multiplying in your body is trying to protect itself on a very, what's the word I'm looking for, Dan? A very non-specific level as it tries to hold off the invader while the correct response is being created in your body, okay? So that's what a macrophage is, probably much more information than you were asking for, but maybe not, maybe not. I love talking about the lymphatic system, maybe not. Oh, thank you, June. All info is good info with a little smiley face. You're very kind. An allergy, we've already talked about a hypersensitivity to a certain compound. So what happens in a very simplistic way is whether you're eating an apple or you're near a eucalyptus tree or you have hay fever, at some point, like, has anybody just all of a sudden had an allergy where they didn't have it before? I know someone said something about you had an allergic reaction one time to shrimp, just one time. Yes, so someone is saying yes. So, if you remember earlier, I said that everything you put into your body gives you an immune response, and you don't even know you're having it. You're having one right now. You're having an immune response. So because you're in an external, you have an external environment and you have dust flying in the air and maybe cats and dogs around you. Maybe you put lotion on, maybe you had breakfast, maybe you're drinking water. I had a friend who was allergic to water. It irritated her skin. She could drink it, but it irritated her skin. We had a student at Healing Hands many, many years ago who was allergic to all fruits and vegetables. All fruits and vegetables. She could only eat proteins and fats and grains. Can you imagine? Can you imagine your body rejecting all fruits and vegetables? Unbelievable. Yes.
I find it interesting with my grandson. The doctor actually suggested to start giving him peanut butter and eggs to build to make sure he doesn't have an allergic reaction to them later in his life.
Oh, wow. Well, he just turned a year old, right?
No, he's coming up on 10 months, not even a year.
Oh, I'm sorry.
So, yeah.
I'm thinking of somebody else. So usually they tell you to wait till they're a year old, but he suggested doing it now.
Yep. Yeah, he said that he can eat anything basically except for honey. He said no honey.
Oh, did you see the no honey? Yeah, because of the bacteria. But did you see Nicole's response?
Yes, I did. That's interesting.
So, well, olfactory. So Nicole's response is, I had my 3-month-old sniff peanut butter and it worked because peanuts and eggs are probably the 2 highest allergens in children, and it could mean the death of a child. And it was not that way when my kids were little. We were just told not to give them honey till they were a year old. But peanut butter and eggs, I gave them all the time. And, but it, for a long time, it was different. Naomi's asking, sorry, what is the difference between a sensitivity and an allergy in terms of the lymphatic system? Well, usually a sensitivity causes a digestive issue. Would you agree that that's the case? Like if you're sensitive to milk, or something that it might cause a digestive issue. However, I don't think it's really that different. An allergy is usually going to cause a skin rash, itching, more systemic than digestive. Although if you're allergic to milk, I understand. If you're allergic to dairy, the digestive issues are so painful that, it's extremely uncomfortable. I still believe your body is trying to make antibodies, but when you have an allergic reaction where your body gets hives or anaphylactic shock or a rash, that means that your body has made the wrong antibodies to that substance that you're bringing into your body. And so that's why they say if you overeat something, if you eat it so much that your body is constantly making antibodies to it, that at some point it could make the wrong antibodies. That might happen with if you get a bee sting and then another bee sting and another bee sting pretty close together, the body might make a mistake and make the wrong antibodies. Whereas a sensitivity, although if you have a sensitivity to something you put in your skin and it causes a rash, that is a mild allergic reaction. And it might just have made a little bit of the antibodies, but then if you continue to use it or ingest it or put it on your skin, the next time your body makes more E antibodies, and then it makes more, and then you have a full-on allergy. Does that make sense? You might take a sensitivity to an allergy if you continue to use that thing that you are sensitive to, okay? Because every time you use it when you're sensitive, you're making more of the wrong antibodies. And then one day you might overload yourself because those wrong antibodies, they actually connect themselves to mast cells, which are in your skin, that release histamine. Other antibodies just float around, like if you get a flu shot and your body makes flu antibodies, they're floating around in your body's fluids because they're there to fight off if you get exposed to the flu that was in the vaccine that you got, or maybe the flu that you had 2 years ago. The thing about the flu is that it mutates. Colds mutate, flus mutate. But if you get lucky and every year the flu comes around, it's a flu you've had before, that may be why you don't get the flu. But when your body makes E antibodies, they're immunoglobulin E. Those attach to mast cells which lie within your skin. And if you keep getting more and more of those, all of a sudden they overload the mast cell. And this is a very simplistic explanation. and then the mast cell opens up and releases histamine, and you get hives, or you get itchy, or you go all the way into anaphylactic shock, which we'll describe a little bit later, okay? I like the whole olfaction, because even in homeopathy, if I have somebody who's really sensitive to a remedy, I have them smell the remedy. And we have a mom here that had her 3-month-old sniff peanut butter, and it started the immune response in a correct way because it wasn't overloaded. And now her child. So can I ask how old your baby is now? How old your 3-month-old is now? Almost 3? Oh, okay. My grandson will be 3 on October 5th. October 9th, they're only 4 days apart. Happy birthday. Yeah, my Max will be 3 on October 5th. It is my favorite age. Yes, for sure. Yes. All right, let's move on. Okay, the spleen. The spleen is an organ, okay? Not a gland, it's an organ. So an organ is made of different tissues, okay? Different tissues. And so it lies just left and behind the stomach, right next to the pancreas, which is behind the stomach. And the spleen is very fragile, okay, because there's so much blood in the spleen. It's full of capillaries because half of the spleen is what we call red pulp. And that red pulp is for storing a certain amount of blood. Now, whenever we say storing blood or blood reservoir, remember that that blood is not just sitting there not moving, because when blood sits without moving, it clots. It just means that it has so many capillaries that it's got lots of arteries and veins and arterioles and venules that are servicing those capillaries. So a lot of blood, like 8 to 10% of your blood is circulating through your spleen as a reservoir if you have an internal hemorrhage. Part of what it does is recycles red blood cells, so it takes them apart and it sends the parts to different places. Like some part of the red blood cell might be used again to make more red blood cells, but another part of it might be sent out of the body, like the pigment that makes your blood its color, the heme. It goes to the liver, and it's part of it goes to the liver, and the liver puts it in your bile, which goes to your gallbladder, which sends juices through your digestive tract. And we'll talk more about that on digestion day. And then the other part of the spleen is white pulp, which is lymph tissue. It's the largest mass of lymph tissue in your body. A lot of B cell activity, proliferation happening in the spleen. If the spleen is removed, the liver can take over its function. However, the immune system is compromised because you've lost this great big mass of lymph tissue. okay? So, but it's a very fragile organ. My son's best friend, when they were like 10, he ripped his spleen. And in order to keep his spleen, he had to be bedbound for like 12 weeks. He can only get up to go to the bathroom and take a shower. And this was an extremely ADHD child that we had to keep entertained for 12 weeks in bed. Okay, very hard. Athletes, if they get injured within the abdominal area, like football players, a helmet to their gut, or boxers, maybe fighters getting punched in the gut, or people, it's really common, the driver in a car accident, if they go into the steering wheel and that bursts the spleen, they're just going to take the spleen out, because you can literally bleed to death through the spleen. Okay. That is the organ that is partly responsible if you get injured in the abdominal area, like a stabbing or gunshot wound. If it rips the spleen open, it's very easy to bleed to death. And unless somebody actually looked at your abdominal area to see the blood pooling in your abdomen, they really wouldn't know. Okay, they really wouldn't know. So you can live without a spleen, but you're going to have and definitely a compromised immune system. Okay, so we're going to go through the 3 functions of the lymphatic system, starting with drains, interstitial spaces, which we've already kind of described. But what I haven't talked about is that because of all the proteins in blood, that the interstitial fluid and lymph are very rich in protein. Now, protein moves fluid, and so one of the reasons somebody might get edema could be from not eating enough protein, not ingesting enough protein. They might get swollen legs or retain water, because you have to have a certain amount of protein in your blood to move fluid. So this is kind of a drawing. What it's showing you is interstitial fluid, or sorry, let's start with plasma. Okay, plasma fluid leaving the capillaries, going into interstitial spaces, entering lymph capillaries, going through several vessels and lymph nodes and lymph ducts, and then getting returned to the heart. So the same thing up here in your chest area, same thing in your head, because we do have lymph in our brain. They use the word glymph, which is G-L-Y-M-P-H. But you won't see it in pictures a lot yet, because it's a pretty new proof. It was a theory that we had lymph in our brains, but we now know that to be true. And so you'll usually see this drawing where you have the systemic circulation from your legs and your arms all coming into the trunk, and then, or into the abdominal area. And then you see that we bring that lymph right back to the heart. So one of the three main functions of your lymphatic system is to drain interstitial spaces and return that protein-rich fluid back to the circulatory system. Okay, that is function 1. I'm going to take a drink of my water. Okay. Number 2, transport dietary lipids and fat-soluble vitamins. So deep down in the last of the small intestine is where you can see here a lot of lymph vessels attached here at the lower smaller intestine. All throughout your small intestine, you have these little hairs, villi, little projections that come off the walls of your inside of your small intestines, and they are epithelial tissue, okay, epithelium. And what do we know? What do we remember about epithelial tissue? We know it's a covering and lining tissue, but what was its specialty? What's the special job that epithelial tissue does? Remember, your epidermis is epithelial tissue. The inside of your mouth is epithelial tissue. The inside of your intestines. So what's the special job that epithelial tissue allows? Okay, movement. Movement is a really good word. Exchange of nutrients and absorption. Absorb. So yes, epithelial tissue, its main purpose is to allow things to pass through it. So movement, in and out. So in this case, our epithelial tissue on the inside of our small intestine, you can see we have veins, arteries. You can assume these are arterioles and venules, and we have capillary beds in between them. And so your proteins and your carbohydrates are passing through the epithelial wall and entering the blood capillaries. Dietary lipids and fat-soluble vitamins are actually too large to pass through into blood capillaries, because you remember blood capillary walls are very small and they don't really stretch open. And so we have specialized lymph capillaries called lacteals. That's the green one that flow right in here. And as the fat-soluble vitamins and dietary lipids come in, they're picked up by the lymphatic system. My theory has always been that, you know, depending on the fats you eat, fats store toxins. They do it in our body. Depending on what fats we're eating, I feel like our human body wanted the lipids and the fat solubles to go through the lymphatic system to get cleaned before they enter the bloodstream. That's just a theory. I've never been able to really have anyone tell me why. It's our lymphatic system that transports those for us. But we know that they transports them through the lymphatic system before they get, they may even travel right from the lymphatic system to the liver, go through specialized lymph nodes, get cleaned, get to the liver, where we know the liver's chemically deciding where all of our nutrients are going to go. And then initiate and carry out immune responses in the body. But what I want you to write down for sure is this little statement here. Your lymph system is not your immune system. Your immune system uses cells and tissues from all your body systems to carry out immune responses. So I'm going to give you a minute to write that down. Okay, I think I have a question. Got it. Okay. All right. Let's see what's next. Okay. So this is just a short conversation I wanted to have before lunch. So this is coming from my homeopathic training. So symptoms are the language of your body trying to get well. Okay, they're the language of the body. Think about the last time you got sick, or when you typically know you're getting sick, how do you know? What is your symptom that tells you that you might be down for the count? Let's see, I can't wait to read these. My eyes burn, fatigued, tired. The skin on my lower back hurts and burns. That is so unusual. I get a dry throat, swollen throat and throbbing, fatigue. Anybody else? We got lots more people in class. Oh, body aches, scratchy throat, lightheaded a lot, fever. Inside of my nose will burn, throat sore and runny nose and feeling tired. Get very tired and achy, moodiness. My mom says my eyelids are puffy, and that's how she knows I'm sick. Difficulty swallowing. Body aches and skin is very sensitive. Lack of energy or I'll lose my voice. Achy eyes, muscle tension. Suddenly cold, but also overheating. I get nausea, headache, confused. I always get a swollen taste bud when I get sick. That is so unusual. I think Dan's in the background waiting to say his.
Yes, and you know what mine is already. I just
Yeah,
asked my wife. She told me my ears get red for some reason. So it's always funny to me.
that your ears get red.
Yeah, my ears get red.
Here we have somebody who suffers with allergies, gets a headache, temples hurt, watery eyes, ears pop, and you got allergies or sinus hits. I get in the root of my nose, way up in between my eyes, I get a little tingling sensation and that tells me that something has invaded me. There's a question. Does anyone, when you get sick, when you feel anxious, or are you asking if you feel anxious when you're getting sick? Either way. Yes, anxiety is heightened when I'm sick. Well, I think, yeah, we've got some yeses coming in. Yes, yes, we've got several yeses coming in. Now, my question would be, do you normally suffer with anxiety? And is it getting worse? We have someone saying, sometimes that happens to me, tickling in the nose. A million times worse when you are not alone. Yes, yes, lots of anxiety. So what I want, what I really want to glean from this conversation is that most people are getting a common cold or a flu. Yes, anxiety is always about my health. So of course heightened when I actually have symptoms. I'm with you. Anxiety has always been around my health since I was a little girl, and I think it's because when I was a tiny baby, it was obvious there was something wrong with my eye. My left eye was closed, it never opened. And my mom took me from clinic to clinic trying to figure out what was wrong. And when we used to talk about it, and doctors would say, oh, there's probably cancer in her brain, there's, cancer in the eye or whatever. And I think that hearing that even as a baby over and over again created anxiety for me around health issues. For me, it wasn't trauma unless you call, being born with your eye closed trauma, but I wouldn't. But and then someone is calling themselves a self-disclosed hypochondriac. Would anybody like to know where the word hypochondriac came from? Okay, so when you divide the abdomen, there's two ways that medicine divides the abdomen, and there is a chondriac location within your abdomen. And if you go below it, it's the hypochondriacal division of your abdomen. And what we find there is a woman's uterus and ovaries. So back before women were taken very seriously, when they would come in with monthly complaints around their period, and the pain was always in the hypochondriacal area of the abdomen, the word hypochondriac was linked to women coming in, the doctors, with female issues consistently. And so they were termed hypochondriacs. And that's where we get the word. It seriously is describing, yes, I think of that all the time when I think about hypochondriacs is, they thought women were crazy and that they shouldn't be having these monthly issues and that it was all in their mind. And so that's where the term hypochondriac became a negative term and not just a division in your abdomen. Isn't that silly? You're welcome.
Hey, Denise.
Yes.
What about the other end of the spectrum where when somebody doesn't get sick? That's just as interesting to me.
Oh, yes. And we'll get there.
Okay. All right.
I'm writing it down. Don't let me forget. Unless, well, okay, you know what? It'll fit here, Dan. It'll fit here. So when you read this line here, symptoms are the language of the body trying to get well. What does that say to you? What does that say to you? Okay, listening to our bodies is good, but what it actually means is that the flu virus, the cold virus, COVID virus, they don't cause the symptoms in your body. Okay, when a virus enters your throat or your nose, however it gets in, and the first thing you feel is maybe a sore throat or a tickling in your nose or fatigue, all those things that you feel, that's your body noticing that the virus is there, okay? And your white blood cells are starting to notice that something has entered your body. And so your body creates a fever. The symptom didn't cause the fever. It creates the fever because the virus came in. Now, for some people, it might be fatigue because when, as adults, we need to be sick, injured, or sleeping in order to have our human growth hormone in abundance to help us heal. The reason for the question, think about the last time you got sick, how did you know? I mean, if I came into a room and I sprayed flu virus on 100 people, you guys were a great example of all the different symptoms that you actually get, even though you might have all been exposed to the same flu virus. I've heard of hundreds of different types of basic symptoms that people get with COVID, even though it's the COVID virus. but your body's language that it uses to try to get itself healthy are the symptoms it creates, like a fever, like body aches, like mucus, fatigue. It is the way that your body is trying to fight it. So symptoms are the language of your body trying to get well. The reason I'm saying this, and I'm going to react to what Dan said, is that if you study people with mental illness, what we find is that they're not often susceptible, because sickness is all about susceptibility. How susceptible are you to the common cold right now? You know, are you eating well, eating your fruits and vegetables, exercising, getting enough rest? Is your susceptibility high? Is your susceptibility low? What's one thing we know that lowers our susceptibility is stress, okay? But the body has a hierarchy of illness, and mental illness is deeper than physical illness. So when you have someone with schizophrenia or extreme depression or apathy, those things that are so deeply ill, is that they're so ill on the mental level that they normally don't get common colds and viruses. And you can learn about that by studying people who are in mental hospitals. They're not susceptible. When I worked for hospice, I did not have to have a flu shot. And so that meant that people with cancer were sick on a deeper level than a cold or a flu, so their body wouldn't even recognize it. Okay, so what Dan is alluding to is that people who say that they never get sick, they might be crazy. That's what Dan's alluding to, in his funny way and in my funny way. They might just be nuts, and so they never get sick. So when people say to me, oh, I never get sick, I'm like, okay, let's just steer away from that person. And of course, I'm saying it and doing it jokingly because I'm not making fun of mentally ill people. But look at how many people live homeless on the streets and they don't get sick. Most of them are mentally ill. They live in poverty. They live in sometimes filth. They live in not a good hygiene, but yet they don't die of terrible illnesses that we might get if somebody doesn't wash their hands when we go to a restaurant and we end up with hepatitis. Okay, so it's just a way of looking at things. Like in homeopathy, we look at the skin as the easiest organ for your body on the physical level to express on. So when we look at a rash on the skin, we think, wow, that's pretty simple and safe. We know something's out of balance in the body and it's expressing it on the skin. It's not the skin that's sick. It's normally an expression of someplace deeper. And if you take my homeopathy class, we'll talk about the hierarchy of illness. And here's another example is sometimes a stronger illness will suppress a weaker illness. And here's a really good example. My brother suffers with bipolar, and he's also needed 2 hip replacements. He needed 2 hip replacements, and they had his bipolar managed, but he had a lot of pain from needing hip replacements, and he was waiting for surgery. Well, while he was waiting for surgery, being bipolar, sometimes they make really bad decisions, and he stopped taking his medication. So now his bipolar is going out of control and his pain is gone now. But I have to have him committed because he is out of control on the mental level with bipolar. And when I took him to the hospital, when I had him committed for a week to get his meds balanced, I took his pain meds with me because I said he can't live without his pain meds. He's got 2 hips he needs replaced. It wasn't until they got his bipolar meds balanced that his pain came back. Okay, so there's one example of a deeper disease suppressing a less serious disease. So mental illness suppressing pain. As I think it's really interesting too. And my mom has an autoimmune disease and she has to take daily medication for it. But if she gets a cold or something pretty, like if my mom were to get COVID, we hope she doesn't, she probably won't, or it'll probably suppress her autoimmune disease while she has COVID. And then as the COVID gets better, the symptoms of her autoimmune disease could come back. So there's a book you can read if you're super duper interested called The Science of Homeopathy. I'm going to write it down for you, by a Greek physician, George Viltoukas, and he talks about the hierarchy of illness in there. I think I spelled his name right. If everyone's in, I am sending it to everyone. If you're not interested, don't worry about it. So anyway, okay, with that said, that's some food for you to chew on, what your body's doing, what your immune system is doing for you. So when you hear of somebody dying of the flu or dying of COVID, now we know COVID caused some lung issues and people died that way. But when we get to flu season every year and you hear of people, dying from the flu, you're like, oh my gosh, that is so scary. Well, they might have been so immune compromised that they couldn't throw symptoms like a fever or mucus or white blood cell or antibody activity. They might not have been healthy enough in their immune function to throw the symptoms that we need to battle that flu virus. So I hope that makes a little bit more sense when people talk about, somebody dying of the flu. Now, somebody with lung issues could get the flu, could go into respiratory distress, pneumonia, and die. But sometimes we hear about people getting exposed to the flu and just dying. And they might not have been healthy enough to fight something as simple as the flu. And those are the people that need flu vaccines for sure. There is a time and a place for all vaccines, okay? Even though it's a very personal decision. So I'm going to leave you with that. My watch says it's 12:19, and I'm going to excuse you for lunch. And I will see you at 1:20. Have a nice break, and I'll see you back. Okay, Dan, I did it. Thank you for bringing it up. I might not have remembered at that moment.
It's always a highlight in this lecture. I enjoy you talking about it, actually.
Okay, good. All right.
Thanks.
Well, enjoy your break. I'm going to go eat something. I'll see you in a bit.
Okay. Talk to you later.
Okay, bye.
Bye.
Okay, we are back from lunch. Hopefully everyone is checking in. Hope you all had a good break. I did. My grandson and I had lunch together because he's home today, and it was really fun. We had spaghetti. Yes, it was very, very, very sweet. Let me see if there's a. Oh, that's a baby picture of him right there. But he's almost 3 now. So we're getting up there. Okay. So, what is oh, some people only got to finish their laundry. Well, I hope you got something to eat. Or you could be eating in front of your computer right now. I would never know it. So you could do that. So what's next on the homework? T cells. Okay. Awesome. How T cells work. Good. That's what I have next in my PowerPoint. So we're looking good. Okay, so there's quite a bit to write here. I'm going to give you a minute to get started. Remember, T cells are in the category, they are a white blood cell, but they're in the subcategory of lymphocytes. Lymphocytes. Oh, sorry. Are we there now? I had my screen frozen. Is that good? Okay. Sorry about that, you guys. I had my screen frozen. Okay. Screen is up. Good. Okay, so T cells. So to start off, all blood cells, whether they be red blood cells or white blood cells, all blood cells are born in bone marrow, okay? So that's where they're created, is in bone marrow. With T cells, though, they kind of march off like they're going to military school. And they head over to the thymus, which is located behind your sternum. And it is part of the endocrine system. And the hormones that it has are used to mature T cells. Okay, so we have several categories of or types of T cells, and the preteens or the plebes or the grunts, they go off to the thymus and they get their instructions. They grow up and they're trained to to do different types of jobs. So we have cytotoxic Ts. I'm on the cell-to-cell combat right now. We have cytotoxic Ts, which the thing about T cells is they can, no matter where the fight is, whether it's in your throat, in your bowel, in your skin, wherever the pathogen is happening that's creating some sort of a disease, T cells can go directly to that place. So your T cells are known as your cellular immunity because they go directly to the place. They can fight cell to cell. We have this cell to cell combat where the T cells can actually spray out a poison. And so they're called cytotoxic Ts, which I have right here under activating B cells. And so they can spray a poison, and that poison is very yummy to some of your macrophages and phagocytes. And once they disable the cell with the poison, or the cell, the antigen explodes because the poison destroyed it, then you've got your phagocytes and macrophages there to eat up the cellular debris. Okay, so the cellular debris can be from anywhere. T cells do really well with fungus, bacteria, cancers, and parasites. They also, of course, fight viruses, but they might decide that a B cell making antibodies is a better choice for viruses coming in. So T cells can fight anything that they choose, but they do have kind of favorites. So suppressing and patrolling, so suppression of the immune system is one, and patrolling for mutations is kind of the same job of one T cell. And so why would your immune system need to be suppressed? Well, once the disease is cured or has finally gone away, like your cold or your flu, we need a T cell to shut everything down. Let everybody know that the fight's over by sending out a new chemical to let the T cells know, okay, or the B cells, or everybody know that it's good, we're good, we can bring the battle down. Let's clean up the battlefield. Let's eat up that cellular debris. Let's. Now, the same type of cell patrols for mutations. Now, mutations happen on the planet, in plants, in animals. Mutations happen in humans. And this is where so cells in your own body, if they mutate, they generally, if they're not found and destroyed, this is what generally can turn into cancer. And so we have T cells that are specifically programmed to find mutations and destroy them. Now, I'll give you a situation where this is the T cell that if somebody has a organ transplant, let's say they have a kidney or a heart, then people like that need to be on medications to suppress this particular T cell because it's out there looking for mutations, and it would see a strange organ possibly as a mutation and try to reject the organ. So when people are recipients of organs, I'm sure it doesn't work with all organs like skin, but I don't know. My nephew, when he died, was a donor to, I think, 40 some people with his skin. So I'm not sure if those people need to take rejection medication or not. But the point I'm trying to get at is that this particular T cell needs to be suppressed. So people who have organ transplants are more prone to cancer because the cancer sort of has free reign to multiply because it doesn't have the T cells needed to patrol. Not that everybody who has an organ transplant is going to get cancer, it's just a higher risk. T cells activate B cells. They might let the macrophage, when the antigen presenting cell comes and says, hey, look what I found. We're going to see a chemical reaction later where the T cell says, we need this particular antibody to take care of this particular pathogen, and we need a B cell to make that antibody. And so that T cell then might also replicate itself to fight this antigen, or pathogen, but it might also recruit a B cell because it feels like antibodies are needed. So how many of you have ever felt like you were getting sick, like you felt your symptom come on that you feel tells you that you're getting sick? Maybe it's a scratchy throat, fatigue, burning eyes, whatever it is. And you think, oh man, I just need to go to bed. And you think I'm getting sick, but you wake up the next morning and you're better. Okay, we have a lot of people saying yes. Anybody in that situation ever feel like they have a swollen lymph node when they feel that coming on? Absolutely, yes. Okay, so when a T cell is located, and a lot of times they're in the lymph nodes. When a T cell is located, if it's located in a lymph node near your throat, then it's going to start replicating itself. Once the T cell is found, because the macrophage has found it, it's going to start replicating itself. So that one T cell is going to become 100,000 T cells, and your lymph node literally swells up from the T cell production happening. That's mostly why we get swollen lymph nodes, especially if it's just like one, because that T cell's replicating itself and it's dividing and then dividing, and then all of those are dividing, and then all of those, and then all of those, and then all of those are dividing, and it becomes swollen with T cells. And then once they're all done, then they march out of there and they may go right to your throat. Now, all this time you had the scratchy throat, what was possibly happening was your natural killer cells were in your throat just dropping poison and destroying your throat cells because it detected that the virus that you breathed in, or you breathed in through your mouth or breathed in through your nose, or you touched something that was infected with the virus and you put it near your mouth, and the virus that got in, your natural killer cells are just kind of floating around in your blood and your saliva, and they might have detected it right there, and they just start throwing poison bombs. just trying to kill the virus until a T cell or a B cell can be found that's going to fight this particular pathogen. And so your throat gets raw because your own white blood cells are throwing poison on your throat tissue. Okay, so that's where the sore throat comes from. Remember what we said before lunch. Symptoms are the language of the body trying to get well. Okay, so it's your white blood cells that are dropping poison. So as the T cells are found, this is kind of your innate immunity working for you, okay? And then, excuse me, I need to take a couple of deep breaths. We'll do it after this T cell slide. Chemically remembered what worked. This is like an antibody. So any T cells that didn't make it to the battle will become memory cells, and they will remember the next time you come in contact with this particular pathogen, and then you could have an immune response without even knowing it. I mean, we're exposed to things all the time that we've had before, but our immune system is just at the ready because of our memory cells, antibodies that remembered the battle, and they're up for it right away. Now you might feel tired for a couple days as your body is sending out that I need to sleep signal because I need to heal. I need to fix some stuff. Okay. All right. I need to take just 2 minutes here to take just a couple of nice deep breaths. Okay. So breathe in through your nose. And blow out through your mouth. I'm going to do one more. Okay, thank you. I'm a little lightheaded from those, which tells me I haven't been breathing. Lily says she cannot get into the webinar. Is that what you're saying? Lily? Doesn't Lily? Oh, Santali. Tell her, okay, tell Santali to restart her computer, to shut everything down, turn everything off, restart her computer, and try to come back in that way. Okay? Whoever's talking with her, that would be a very big help. She has to shut everything down, okay? Shut her computer down, start it up again, and then come back in. Okay? And then maybe those of you can share the T cell notes with her, because that's what we've been talking about for 20 minutes. Thank you, Carlos and Miriam, for listening to Santali and being in touch. Okay, B cells. I'm going to give you a minute to write this down. And I'll give Santali a minute to get back in. Okay, so now we're going to talk. Oh, let me see what's happening here. Oh, good, Santali. Yeah, you want to try to remember instead of beating your head against the wall for 20 minutes, shut your computer down. Something gets glitched in there. And I know it's hard to remember that. But usually, yeah, usually something happens and everything needs to be cleared up before you can get in. So if you have a couple classmates, the only thing we've done so far was talk about T cells. So if you have a couple of classmates, I would share that info with you. Yeah, do you want to take a screenshot of the slide? Oh, you got it. Okay. All right, good. Okay. So B, not this slide, the T cell slide. You got the T cell slide? Okay. All right, B cells. So here we have a little activation going on here. So B cells are also born in the bone marrow, okay? Just like T cells, red blood cells, and all immune cells. However, they stay in body fluids, your blood, your lymph, your interstitial fluid. This is known as your humoral immunity because your body's humors are your body's fluids. Okay, your body's fluids are known as humors. And so this is your humoral immunity, whereas with your T cells, it was called your cellular immunity. Okay, your cellular immunity. So B cells are born in bone marrow and they stay in the fluid. So they're activated by T cells because they don't just act on their own. It's usually a chemical message that they get from possibly a nearby T cell that tells them, you know, they need to get active here. So what they do is, let's say, so here's the foreign body. This is our pathogen. And you notice the pathogen has little spikes on it. Okay, we'll just say this is a COVID virus. And it's floating around, and you know, viruses need to get into your body cells and then divide so that they're in both body cells. So that's what's so dangerous about a virus is they actually just log right in to your body cells and take them over. And once the virus gets inside your cells, it can just continue to replicate itself over and over and over and over again. And then the cell releases the virus, and the virus just starts traveling all throughout your bloodstream. And this is why it A virus affects you all over, where a bacteria is usually local. So every B cell is born to make a certain antibody. Okay, so this B cell here makes an antibody that's shaped like this little Y. And what happens is, here's the foreign body. Foreign body takes a bite, the macrophage takes a bite out of the foreign body and processes it through its own form of digestion, and then has these little virus spikes here looking for a T cell, a helper T cell, to say, hey, dude, this is what I found. What should I do with it? And the helper T goes, you know, I don't think I can fight this alone, or, you know, I'm a great big general and I'm on vacation, so I'd like to get a B cell to handle this for me, or let's battle this together. And then the cytokines are chemicals that the helper T sends out that identify looking for this particular B cell that makes this little Y antibody. And once that B cell is activated, it gives birth to what we call daughter cells. Okay, several daughter cells, and they're called plasma cells. So here's a plasma cell, here's another daughter cell, here's another daughter, and those daughter cells are called plasma cells. Not sure why. And what those daughters do is they give birth to hundreds and hundreds of Y antibodies, because this is the antibody that we need to disable this foreign body. And how they do it is the virus uses their spikes to get into your body cells. So once the B cell gives birth to the daughter cells, called plasma cells, and we call them antibody producing factories. Okay, antibody producing factories. These antibodies then get released into the bloodstream or the lymphatic stream, wherever they happen to be, and those Y antibodies start circulating throughout the blood and the lymph. And when they find the virus, they dock on the virus. And as soon as they've docked on the virus, this virus becomes not at all dangerous to your body because it doesn't have its spikes to get in. The spikes are being covered by the antibody. Okay? So each plasma cell is specific for the certain protein or antibody for a specific antigen or pathogen. And then they circulate throughout the blood, the lymph, the interstitial fluid, and they're just looking everywhere they can for this virus. And they're going to deactivate the virus by landing. Once they've landed and this virus can no longer get into your body cells, then we're going to have a phagocyte, a macrophage that can just come and ingest the entire virus, the entire virus chemical, so that we can get rid of all the rogue virus in your body according to this B cell and daughter cells here, whichever one it was programmed to make. And so this is how we start getting better over the course of days, as our antibodies are running around, they're finding all the viruses, locking on, and then suddenly it's suddenly like the virus just falls somewhere because it just can't, it's not motivated to race around your blood anymore. And the virus is made disabled. All right, someone has their hand up. It could be an accident. If it's not, can you type in the question box? Let me see whose hand is up. Oh, Alexandra, you're on twice, so maybe your hand is up for that. Not sure. No, that's okay. I just like to check in case you've lost your sound and I haven't looked at the question box recently. Okay, does anybody have any questions on B cells and T cells? Okay, so only one person's responded, so I'm assuming that means no for most of you. All good, thank you. There are 41 people in class, so it's good to get a little bit of a response when I ask. All right, let me get these erased. And if I'm going too slow for some of you, I'm sorry, this is just probably a better pace for most people. Okay, let's see. I got to get my normal drawing back, and then I have to erase the pictures. Beautiful. Okay. Okay, so now we're going to look at the root of lymph. But I really think that I want to go to the next question first, which is lymph node locations. I think this would be a better order. Okay. So lymph node locations. This is not the clearest depiction because, I don't know, it's just pretty basic. But the second largest grouping of lymph nodes is our cervical lymph nodes, so the neck and throat. Remember, our first largest group of lymph nodes is in the abdomen and chest. These are the deep lymph, the deep lymph that are within your thoracic cavity and your abdominal cavity, okay? So then we have the neck and throat. And then we have the axillary, which is your armpit, and breast area, both for men and women. And we do have 3 sets of axillary nodes that one is deep into the armpit, one little group is underneath the pec minor, and the last little group is just medial to pec minor, but they're pretty superficial. Next is where your elbow bends. That is called the cubital or front of elbow antecubital lymph nodes. Then we have the abdomen and chest, again, where we find half of our lymph nodes. And then we have the groin or inguinal lymph nodes. That's the inguinal ligament that goes from the as is on the ilium to the pubic bone. And that's directly underneath that ligament is where we find the inguinal lymph nodes. So, and these are easily palpable, meaning that when we're pumping them, they are easy to feel. Not many of the lymph nodes in your body are easy to palpate, but these are. And then we have the popliteal, which is behind the knee. So can anybody look at this list and tell me what these locations have in common? What do they have in common? Areas with movement. They're in our creases, yes. Joint areas, yes. Sensitive areas. So when you look at all of them together, they're everywhere that we flex. Okay, they're everywhere that we flex. And so since our head, our throat, our armpits, the groin, the elbow, and then the back of the knee, it's everywhere we flex. And so muscle contraction is one of the ways that that moves lymph for us inside of our body, those things that come intrinsically. So muscle contraction, joint movement, it's all the places that are kept warm. We don't have lymph nodes where we extend, we just have them where we flex. And that flexion definitely helps to pump the lymph through the nodes and get them moving. Okay. Okay, I'm going to go back to lymph circulation. And we're going to start with the fluid in a blood capillary. Okay. So we're going to start with the fluid in a blood capillary. And at this point, we'd call it blood, or we could call it the plasma of your blood. Okay. We could most likely, the answer on a test would be blood. All right, and then we've talked about each time the heart beats, it squeezes out a percentage of the plasma into interstitial spaces. And so what do we call that fluid? Yeah, it's not lymph yet because it's not in a lymph capillary. But yes, Gabby, it is interstitial fluid because it's in interstitial spaces. And so we call it interstitial fluid now. It didn't change. It didn't change. I mean, the red blood cells stayed back here. Red blood cells stayed in the capillary, which is why our lymph is clear to yellow, again, depending on your level of hydration. And then from here, we're going to be picked up by what? What's next? From interstitial spaces, what's going to pick it up next in the circulation? Yeah, but which lymph vessel? Yes, good job, Rachel, Gabby. The capillary. Capillary comes first, lymph capillary. And now what do we call the fluid? Now what's the fluid called? Now it was interstitial fluid, now it's called, yes, now it's called lymph. Yes, so we're in a lymph capillary. From a lymph capillary, where do we go? Remember, the lymph capillaries are at the beginning. Now we go into lymph what? Yes, good, Rachel. We go into lymph vessels, which contain lymphangions. Okay, so we go from a capillary to a lymph vessel. The initial lymph vessels have different names like pre-collectors and collectors, but that's not something we need to know. We don't even worry about the difference between collectors and pre-collectors when we do lymph. So we go into a lymph vessels and we go into a series of lymphangions. Okay, so let's pretend that those lymphangions or the lymph capillary was down in your foot. Let's compare it to the root of a blood vessel, a blood cell. Let's pretend it's down in your foot. So if it travels up the leg, let's say it's in the back of the leg, what might happen when it goes to the back of the knee? What might it pass through? What might it pass through if your lymph goes through the back of your knee? What do we find in the popliteal space behind your knee? I'm making you guys work for it. Come on. Yes, good job. Lymph nodes. Yeah, lymph nodes. So the picture I'm trying to paint for you is that no matter where the lymph capillary is, it's going to take the lymph through from the capillary to lymphangions, which are lymph vessels. And from a lymph vessel, it's eventually going to pass through a lymph node where it's going to be filtered and concentrated. So I am actually right now going to change this slide. All right, let's go back here. So the closer lymph gets back to the heart, the thicker it gets, because one of the functions of lymph nodes is to concentrate the lymph. So it's going to go through lymph nodes. Now, what about after it goes through the knee? Now it's going to go back to what? Lymph vessels, right? It's going to go up here, and then what's it going to get to the groin? Yeah, it's going to go through the inguinal nodes, right? Yeah, it's going to go through the inguinal nodes. So, and then it's going to go through the inguinal nodes, and then it's going to dive really deep into the abdomen, and it's going to hit another group of vessels, and then abdominal nodes, and then more vessels, and then it's going to eventually get to, let me get this going. So I don't know why this picture's in the way of the words. I don't know why. I don't know if I moved it, but I'm assuming it says lymphangion, okay? So the points that I want you to get here is that no matter where the lymph capillary is, that lymph is going to be pushed through the lymphangions, the lymph vessels. And let's say it was in the front of your leg. Well, it's going to bypass the popliteal nodes, and it's going to go to the inguinal nodes. And then it's going to go into the deeper abdominal nodes. And maybe it'll go through some of the nodes of digestion. And then it's going to, but it's going to go vessel node, vessel node, vessel node, because lymph nodes lie along vessels. Okay, so wherever we have a bed of lymph nodes, they're connected by lymph vessels. So this vessel to vessel can happen 100 times before the lymph that entered the lymph capillary in your foot gets back to the heart. Okay, that can happen going up the arm, coming out of the head. That can happen anywhere because you have, gosh, I recently had a student that had 14 lymph nodes taken out of her axillary region, but there's probably 20 left. So if 15 nodes lay along the same vessel, then all the lymph that travels from that vessel to a node, a vessel node, vessel node, vessel node, that can continue on through 100 lymph nodes. And easy peasy without a problem. So each time that lymph is going through a node, it's getting processed. And then we have these nice big lymph trunks. Okay, we have this big thoracic trunk, and then we have a left trunk over here. And the trunks are just bigger vessels that are starting to gather all the vessels to themselves, to the lymph trunks. And then we have a left thoracic duct, and we have a right lymphatic duct. Okay, so all these bigger trunks are leading into a duct. So we have a right-sided duct, And the left-sided duct is called the thoracic duct. And so we have one on each side. And then the ducts take them to the venous angles. So when we get to venous, what are we back to? When we get to a venous angle, what is happening to our lymph? Can we see here? We have the thoracic duct is connected to the venous angle. We have the right lymphatic duct is connected to the venous angle. So what is our lymph now rejoining? Yes, it's rejoining the bloodstream. Excellent. And once it rejoins the bloodstream, these veins take it to the vena cava and right back into the right side of the heart. So this is where it's re-entering the bloodstream. Now, we know that this has been a lot of fluid, but we also know that lymph nodes are helping to concentrate the lymph. So this fluid is entering a very low pressure area. So it came out in an area of high pressure at the capillaries, but it's being returned to the heart in a very low pressure area, and then it rejoins the heart. And now all that lymph has been cleaned. But if you can imagine, every time your heart beats, it is producing interstitial fluid, which is then becoming lymph. So there's no running out of lymph, no matter how fast your little MLD hands can move it, because unless the heart stops beating, interstitial fluid is always being created. Therefore, lymph is always being created. All right, from the venous angles, takes it to the vena cava, and then into the right atrium of the heart. So in case you don't have this written down, you want to make yourself a little note here, from vessel to node to vessel, that this is going to happen at every place where we have groupings of lymph nodes, where it can go from vessel to node to vessel to node to vessel to node. Because I'll come right back. If we go back to lymph node here, we can see we have lymph vessels with lymphangions coming into the lymph node. Now you notice we have 5, but since the lymph is getting concentrated, we always have less coming out. Okay, these are the efferent vessels coming out. So we have more vessels coming in than we do coming out, because water is extracted from the lymph nodes. So there gets to be less lymph coming out. Okay, I'll give you a chance to write this in case you haven't done that yet. All right, questions. Let me check the question box. Well, wherever there's groups of nodes, so like here in the groin, So you see how what's connecting one node to another is a lymph vessel, correct? Oh, you got it. Oh, okay, sorry. Oh, so two of you were asking the same question. So where you see groups of nodes, so we have lymph traveling up these vessels here, and then they get to a node, and it goes through the node to another vessel, to another node, to another vessel, to another node, to another vessel, to another node. So lymph nodes lie along lymph vessels. And so as the fluid is going through a node, then it comes out a vessel that could lead it to another node. It goes through the node, it could lead it to another vessel, to another node, vessel node, vessel node. Just wanting you to remember that part of the circulation, that it's not going to be just one vessel, one node, and then one vessel. These three here could repeat themselves 300 times, depending on how many lymph nodes are en route from where the lymph circulation started. It could have started in your foot, in your hand, in your head. We have a ton of cervical nodes in what we call the cervical chain. It makes a big triangle on the side of your neck. And there are several nodes there that your lymph is going to travel through. Vessel node, vessel node, vessel node, and so on. Did that clear it up? Excellent. I like when we clear up a question. Okay, let's see what's next in our homework. We've already done this, lymph node locations, throat and neck, axillary, breast, antecubital, abdomen, chest, groin, inguinal, popliteal, behind the knee. Oh, sometimes we do find lymph nodes around the ankle. And I've also heard that sometimes we have lymph nodes around the wrist. It's just not really popular in books to see that. Okay, so what happens in lymph nodes? You probably could answer this question by now because I've kind of been answering it all day. And that number one, it filters lymph. Filters lymph. We have all these little filtering stations where we have B cell and T cell proliferation, meaning one B cell divides and becomes two, and two become four. And this is where a B cell might give birth to a daughter cell. This is where a T cell might actually go straight to battle if the virus has made its way into our lymph node. This is going to be where macrophages and phagocytes might go to find the T cell and present the antigen to the big boss or the big general, so to speak. And then we know that it concentrates the lymph, meaning it's pulling water out of it the closer that it gets to the ducts. Give you a second to write this down. All right. I am going to, I think histamine is next. Oh, I know. I was going to show you what. Okay. So is everybody good with this slide? Okay. So the reason I'm going to show you these next two slides is just to give you a little perspective on the way lymph flows, seeing as you are massage therapists, of course. And so what these pictures are showing is, and for those of you that just had lymph, you kind of understand. I found some different pictures here, but these dotted lines here are called watersheds. So these are the two most important watersheds we have, plus the clavicular and the scapular watersheds here. But what this is showing you is the lymph capillaries that are in the chest here and the lymph capillaries that are here, they don't mix, they don't go over watersheds. So the lymph that's in this part of the skin drains up and drains down towards the axillary nodes. Below this watershed here, these lymph capillaries drain down to the inguinal nodes. Whereas we know the blood vessels are going up towards the heart. And so even here in the low back, we have a watershed here, but we don't have lymph nodes back here. So all this lymph here from the waist down has to go around to the front and down into the inguinal nodes. Okay, so watersheds are showing you the division between circulation in lymphatic or lymphatomes in the body. And so, you know, when we're massaging up the leg, let's say with circulatory, we're definitely pushing lymph in the right direction. So although if you look at the back of the thigh and we're pushing up, you know, on the blood, the lymph goes to the left and to the right, comes around to the front, and then up into the inguinal nodes. So that circulation between lymph and blood is pretty different. Okay, so even though we can move lymph when we're doing a circulatory massage, we're not always moving lymph in the direction that it wants to go. Okay, and not that we're causing any harm, but that's why manual lymph drainage has its own recipe and directionality because of these watersheds that we find in the body. So the lymph back here on the top of the shoulders comes around, joins the cervical nodes, and drains down here right into the heart. And so now the deep, deep, deep lymph in the abdomen does flow straight up, but the lymph in the skin flows out into 4 different directions. Same as on the back, up, over, around, around. So the lymph in the skin is what travels very differently than blood. And then the other picture I have to show you just shows you that the left thoracic duct over here drains both legs, drains the chest, the arm, half the head, and the neck. So it's a huge area that this big, gigantic duct drains. Whereas on the right side, the right lymphatic duct, which is way up here, only drains the other half of the face, the chest, and the right arm. So this is very out of balance as well, and nowhere near like the flow of blood. And that could just be this wonderful divine plan for getting lymph filtered and moving in different directions. I mean, we don't know why the body was built this way. We can only take guesses. Some people think it's because the heart is more on the left side of the body, and therefore the bigger responsibility for drainage and movement of lymph is on the left side of the body. But I'm not sure anybody really knows why the body is divided up this way. Now in lymph class, we learn how to cross the watersheds in case someone has lymph nodes removed. So that was just a little caveat. We're going to go into histamine, but I really want to show you the video first. And Dan, are you there?
Yes, I'm here.
I accidentally loaded the wrong video for allergy. I loaded the germ video.
Oh, I hate that when that happens.
I don't know what I was thinking, so I'm going to show him the flu video.
Okay.
We haven't seen that one in a while.
You haven't, but the germ video would work too, no?
No, that's the one on food poisoning.
Oh, okay.
Yeah. Right. Anyway, I hear Princeton.
Yeah, he's in the background.
He's in the background.
Yeah, playing away.
All right, so I think I'm going to give you guys a quick 10-minute break because you've been sitting for an hour and 10 minutes, and then we'll show a video. How's that? So it's 2:29, so 2:40. We're going to take a little break with a video because my throat's getting a little haggard from talking, so I need a little bit of a talking break. So I'll see you in 11 minutes, 10 minutes. Okay, everybody, I'm going to go ahead and start the video on the flu, and then I will see you after.
The following presentation is brought to you by Discovery Channel School, a leading provider of quality educational resources that help teachers bring the world to their students.
Consider this before viewing Body Story, the flu. Discuss what you already know about viruses. Are they cells? How are they transmitted? How does the body try to defend against viruses? As you watch the program, note how a virus affects the human body and how the body's immune system prepares for battle. Assignment Discovery now presents Body Story, the flu. Holly Jones is a healthy young woman.
Hi, Mayfield Stanley? Sixth floor. Thank you.
But her body is about to become a battlefield.
Can you hold the doors, please? Hold on.
A sneeze explodes into the area at 40 miles an hour, sweeping 100,000 droplets of mucus into every corner of the elevator.
Excuse me.
Bless you.
Most of these droplets are harmless, but some carry living organisms which are highly infectious. These bacteria and tiny viruses will spawn inside a human body. The cold, dry air of the elevator will kill them in minutes. They urgently need to find another human host.
I'm a singer.
Are you hoping to give up your day job then?
Yeah, the uniform's too hot.
The invaders have found refuge in Holly's nose, but they're not safe yet. First, they must get through the forest of hairs which lines her nostril. These hairs are her first line of defense. They trap nearly every particle she breathes in. The invaders are swamped by a wave of mucus. For the bacteria, this is as far as they will get. An enzyme in the mucus dissolves them away. But just one spiky virus survives. As Holly breathes in again, She rips the virus from her nose hair and sucks it into the cavern of her nostril. This is one of the more common viruses, called influenza B. It's on a mission to multiply. And to do so, it has to hijack a particular kind of human cell found in the lining of Holly's throat. The virus is now at the top of Holly's nostril. If it can reach her throat, it has the power to cause her total misery. Her winding nasal passages are designed to trap invaders and wash them into her stomach to be destroyed. But Holly's own breath pulls the virus free yet again, closer and closer to her throat. Against all odds, the virus has made it to Holly's throat. As it burrows through a thick sea of mucus, it approaches the cells which are its target. Now it has to pull off one final trick. The flu virus has evolved to take advantage of the way that human cells work. Holly's cells communicate with each other using proteins as messengers. The spikes on the virus allow it to impersonate one of these proteins. It docks with receptors on the surface of Holly's cell. The cell is fooled. It reads the virus as a harmless protein. The virus slips inside. The first stage of the invasion is complete. It's 7 hours since Holly first breathed in the virus. She still feels fine, but deep inside her throat cell, the virus is already wreaking havoc. It has seized control of the cell's machinery. Instead of making proteins, the cell is manufacturing components for thousands of new viruses. Holly's cell has become a virus cloning factory. From this single throat cell, 10,000 viruses are born. Each new virus will set out to hijack another cell and turn it into a new cloning machine. Phase 2 of the invasion is on the way.
I know this music journalist might come down and give us a review.
Really?
Yeah. Right, I'm just going to run through what we're going to do on Friday. Obviously, set drums up, back, yeah. We're going to have 2 sets of 4 rounds.
In just 2 hours, the virus has infected 5,000 cells in Holly's throat.
Then, Dave, you're going to be stage left, so get all your gear around here. Sal, your stuff's going to be here, set all of your gear up there.
If it spreads to her lungs, it could make her critically ill.
Really, but I would imagine 1, 2...
It's time for her body to fight back. The frontline troops of the immune system are the natural killer cells. They patrol Holly's body looking for trouble. They spray a poison to destroy the pieces of virus being hatched inside the cell. But this is warfare of the crudest kind. In the process, many of Holly's own throat cells are obliterated.
Keyboards at right angles, so that's no problem. Excuse just a second, love. Thanks. You're going to have the full run of the whole stage. Now, we've got 4
Sorry to
tea
interrupt
bags.
the band, Mrs. Alex. Might get another coffee. Anyone want one?
Oh, yeah, please, Monica. Cappuccino, no sugar? How long have you been going out with her?
The crude methods of the natural killer cells aren't enough to contain the virus. It's now breeding inside 500,000 of Holly's throat cells. Somewhere in her body, she does possess the ultimate weapon against influenza B. 2 single immune cells capable of wiping out the invasion altogether. But they are 2 cells among trillions. And until they're found, Holly's natural killer cells must soldier on alone. The collateral damage gets worse. Cell debris piles up in her throat. If it isn't disposed of, she could choke as she sleeps. But Holly's immune system has its own cleanup crew. These macrophages dispose of cell debris in a simple way. They eat it. Debris that isn't devoured by macrophages is carried away on tiny beating hairs called cilia, to be swallowed and digested. For the first time, Holly can feel the effects of the battle being waged beneath her skin. Trying to contain the virus, her own immune system has destroyed thousands of throat cells. Holly's throat has become raw and swollen and sore. Holly is getting the flu, but her symptoms won't be caused by the flu virus directly. Instead, they'll be triggered by the desperate rear guard action of her own body. The next phase in Holly's immune response has begun. Now her whole body will be recruited into the battle against the virus, and her well-being will be sacrificed until the war is won. The macrophages working in her throat release chemical smoke signals called interleukins. Interleukins surge through her bloodstream, summoning reinforcements to the battlefield. The interleukins also make Holly feel terrible. They make her nerves hypersensitive, so the slightest movement causes her pain. The virus has only attacked a tiny patch of cells in her throat, yet her body aches all over.
Just go and get some rest. You'll be fine.
But her pain has a purpose. Holly's body is telling her to slow down. She'll need every ounce of energy to defeat the virus.
Look, you don't have to stay in just because of me, Rach.
Actually, I'm not. I'm going out in a minute. Look, you all right? Do you need anything?
I'm freezing. You just don't care.
See you later.
The interleukins have opened up a new front against the virus. Holly's brain contains a natural thermostat, which keeps her body temperature at a steady 98.6 degrees. Unfortunately, this temperature provides a perfect breeding ground for influenza B. So the interleukins turn her thermostat up. This tricks her body into thinking it's cold. She shivers to heat herself up. Holly is getting a fever. As her temperature rises, virus cloning slows down. But other processes in her body speed up. New immune cells are produced at a faster rate. Even her hair and nails grow 20% quicker than normal. Holly's raised temperature makes the blood vessels around her brain swell. The pressure gives her a throbbing headache. Though very high fevers can be dangerous, it's not bad that she can't find any pills for her headache. Painkillers would also lower her fever and give the virus a new lease on life. Holly feels dreadful, but her immune system will make her suffer for as long as it takes to defeat the virus.
Hello? Oh, hi, Dave. Yeah. Yeah, much better. No, really, I'll be fine.
News from the front isn't good. More and more killer cells have arrived in her throat, but millions of new viruses are still being spawned.
Okay. Well, come and check on me in the morning. All right. See you then. Yeah. Bye.
Holly's chances of singing on stage in 24 hours are looking remote. Her body is losing the war. Holly has been fighting the virus for 36 hours with no sign of success. But somewhere in her body there exists a weapon so powerful it could destroy the virus completely. The task is to find it. All over her infected throat, cells called dendritic cells have been gathering fragments of virus. Wearing virus spikes like badges on their surface, they go in search of the ultimate weapon against influenza B.
You're not eating anything. So you clean the bathroom. That's all right, I'll get on my way out. See you later. Hope you're feeling better.
Bye.
All of Holly's hopes are pinned on the dendritic cells. The immune system is one of the most remarkable features of the human body. Here in Holly's lymph, 1 trillion cells known as T cells and B cells are floating, each one individually designed to kill a different foreign invader. Each one waiting for the call. And among these trillion cells, just 1 T cell and B cell are designed to deal with influenza B. If they're found, they'll mount a devastating pincer attack on the virus.
You're right, Hal.
Hi.
How you feeling, Hal?
Terrible. I'm sorry, but we're going to have to cancel.
The thing is,
A dendritic cell reaches one of Holly's lymph glands. It offers up its virus spikes, seeking out the one cell which might recognize the virus. Finally, it docks with a T cell. For 25 years, this one T cell has been waiting to be called into action. It begins to divide. Within hours, the original cell will become thousands of T cell clones.
You don't look good.
No?
Sorry.
What, I thought I'm ill, that the minute I'm not around, you let Alex kick me out.
So who's this Monica then?
She's Alex's girlfriend. He wanted her in the band from the beginning.
Can she sing?
She knows the songs. She hasn't got the stinking flu. They'll be on stage now.
Packed with dividing T cells, Holly's glands have begun to swell. But this time, her pain is a sign that the tide is turning. The T cells are launched into her bloodstream. In Holly's throat, the T cells arrive in the thousands. They home in on infected cells and take them out with surgical precision. The final battle has begun. Holly's cough is further evidence that the T cells are winning. The cilia, which carry away cell debris, have themselves been damaged in the battle. Now, the only way Holly can clear this debris from her throat is by coughing.
Phone right now, so just leave your name and your message and we'll get back to you as soon as possible. Bye.
Hi, Al, it's me. Yeah, it didn't go too well last night. Anyway, could you meet us at the cafe Wednesday lunchtime? If you're up to it, of course. Bye.
Meanwhile, the other half of the pincer attack has begun. In Holly's lymph, a B cell has recognized a virus spike and begun to clone itself. Unlike T cells, B cells don't go to the battlefield. Instead, they manufacture millions of minute proteins called antibodies. Like tiny heat-seeking missiles, the antibodies target newborn viruses, locking onto their spikes. Smothered in antibodies, the viruses are paralyzed. They can no longer infect Holly's cells. The invader has no place to hide. The viruses breeding inside cells are killed by T cells. Free-floating viruses are neutralized by antibodies. Between them, they will wipe the virus out. But Holly's symptoms won't disappear just yet. Only when her immune system scales down its effort will she start to feel better. It has taken a week for Holly's body to beat the virus. On the battlefield, new throat cells are starting to grow. Most of the T cells, their job done, shrivel and die. But some, known as memory cells, will patrol her body forever. The memory cells make Holly immune. If the virus tries to invade again, they'll instantly wipe it out. But influenza B has one more trick to play. It can mutate so that the next time Holly's memory cells might not recognize it, and she'll get ill all over again. Though Holly no longer has flu, the last few viruses remain in her saliva. Her virus can't survive outside a human host. It urgently needs a new body to colonize.
Keep watching. Discussion topics and
Okay, what do you guys think? Yeah, cool video, wear a mask. Interesting, well done, they're helpful, they do a good job. Well, yeah, once we do all the definitions and stuff, when they put it together in a story like that, it just really helps to put it all together for sure. Yes, thank you for all your positive comments. I really appreciate it. So we're going to move on to histamine from here. And I don't think there was a histamine reaction in that video. This is really what would happen with allergies. So I had intended to show you an allergy video, but I loaded the wrong video. So I'm going to start at the bottom because, sorry. Mast cells, which is this little bugger right here, okay? First of all, they're found wherever your body is in contact with the outside world. Now, you might think that's just your skin, but that's inside your eyes, your nose, your mouth, your ears, your bronchial tubes, you know, because you breathe in, your digestive system, anything that's in contact with the outside world contains mast cells. So there's a ton in your skin. If you've ever had hives, then you understand about mast cells in the skin, okay? These are the cells that when your body makes the wrong antibodies, like if you're eating strawberries or mushrooms or peanut butter or shellfish, at one point your body made the wrong antibodies, and those antibodies were IgE antibodies. And instead of bringing in T cells and B cells or not having any reaction at all, the wrong antibodies went and glommed on to a mast cell, okay? When histamine is released, you have an immediate inflammatory response. Histamine is telling your body that we have a potential attacker, and the attacker is so dangerous that we need to flood the body to get whatever it is out of the bloodstream. Okay, we have to get it out. And so the inflammatory response causes your blood vessels to dilate and increase their permeability. So now those once tight, small capillaries are now releasing more fluid than they should. And what they're hoping is that all the white blood cells you have are going to come out and come to this battlefield. We don't even really know what the battlefield is, whether it's on your skin or in your blood or in your lymph. But when the histamine gets released into your bloodstream, it just causes this avalanche of reactions, starting with permeability of your blood cells. And it also once the histamine is released, that's when you'll actually see the hives on your skin. That's when you can get itchy and a headache, because histamine causes headaches, itchiness, and a rash, because There's so much histamine stored in your skin in by way of these mast cells. If you get an itchy throat, itchy eyes, itchy mouth, itchy ears, same thing. You've got so much histamine coming out with this all in all these places that are so connected to the outside world. And they're doing that because they're trying to protect you from whatever this invasion is. What this picture is showing you here is where a B cell was called into play to make an antigen, and it gave birth to a daughter cell. And here's the antigen, but here's the antibody that the antibody that's coming out, and it's not the correct, it made the wrong antibody. And those antibodies are attracted to the mast cells, and they'll literally glue on. And then the next time you have some more strawberries, or the next time you're stung by a bee, and it's been a close enough period of time that you've got all these antibodies stuck to your mast cells, and you add some more, that's when you can finally go into anaphylactic shock. So when there's so much histamine being released into the bloodstream, the more histamine, the more blood that escapes your blood vessels. Now, if you think about the small area of your throat, which is where anaphylactic shock happens, is so much fluid is coming from your blood that it's filling the tissue spaces. It's filling interstitial spaces. It's not filling the lymph. It's not in the bloodstream where it's supposed to be. It's actually filling the tissue in between, and your throat swells to the point that you could actually close off and not be able to breathe, not be able to swallow, and you have so much histamine that you start getting short of breath because all of the fluid of your blood is outside the tissues where it's supposed to be. When this happens, your body automatically puts out adrenaline. Okay, so for those of you that have allergies and have to carry an EpiPen with you, your body knows what to do. It knows to put out adrenaline, which will close the blood vessels, gather the fluid back in, stop the swelling, you'll be able to breathe, and you won't die from anaphylactic shock. However, the body's adrenaline in face of so much histamine is sometimes not enough. And this is why people with severe allergies need to carry an EpiPen with epinephrine in it, which chemically is a lot like adrenaline, the adrenaline coming from your adrenal glands on top of your kidneys. So that's what happens with histamine. So you might have just like when a mosquito bites you. Some people are really allergic to mosquitoes, and that bite swells up and it itches terribly, and it swells up out of proportion to what a mosquito bite normally would be. Some people are allergic to shellfish, and it is to the anaphylactic state where it closes off the breathing tube. That's okay. That's you, huh? I'm so sorry about that. Anaphylactic shock is very, very scary. When I went into it, I was having a medical procedure, and so it was so easy to reverse. It was immediate to reverse it. I had an allergic reaction to the iodine-based dye. And of course, they had told me that day to never eat shellfish, which I have an aversion to it anyway. So sometimes your body tells you what it wants and what it doesn't want. So shooting in adrenaline. So yeah, I think it's really helpful to understand what's really going on actually inside the body, right? If you want to do a scratch test on yourself, if you take one hand and scratch the flexor skin on your distal arm, scratch it for 30 seconds, you are actually activating mast cells. We believe that the histamine, the reason we get itchy, was there so we would scratch off parasites. Someone is mentioning when they were a child, they were allergic to peanuts, but now you're okay. You can eat them and nothing happens. Well, I will say what I often say, you know, why the lymphatic system turned around one day and stopped making the wrong antibodies, I don't know. But it could be if you went a long time without eating them. Anything that the body can make, it can break, and anything the body can break, it can make. So I think things can be healed under the right circumstances. I mean, we know now from what I just said that an allergy is caused by sometimes the wrong antibodies, and maybe your body just stopped making the wrong antibodies. And the new question is, do you know what causes mast cell activation? Yes, anything that feels like it is attacking the immune system can activate your mast cells. So I just had you guys scratch your skin for 30 seconds. If you didn't do it now. And you'll notice that the reaction in your skin is to turn red. That's because you have activated mast cells and they've let out some histamine in that area. Have you ever felt itchy after a massage? Especially an area that's worked on a whole bunch. The possibility is that they've released histamine into the skin and you get itchy. So there's lots of things that can lead to a mast cell activation. Okay, so we have our FYIs and pathologies. So we have autoimmune diseases where the body or your immune system has decided that something within your body that belongs there is now a foreign invader. And so rheumatoid arthritis is the middle picture here, is a systemic autoimmune disease where your white blood cells attack the small joints of your body. Now, systemic because when they're under attack, they can feel fluey, they can feel tired and achy all over. um, and feel, feel that all over like they're ill. But when they're not in a systemic, they may just have the joint malformation here that they get after a long term with the disease. Multiple sclerosis, if we remember from Nerve Day, here's a beautiful myelin sheath around the axon of a nerve fiber. And here's scarred myelin from your white blood cells chewing away at it like it was a Thanksgiving dinner. We have diseases that attack the nucleus of a nerve cell, like with Lou Gehrig's disease, myasthenia gravis. The white blood cells eat away at the ACH that you need to contract your muscles. And we're not sure. It's just kind of like an allergy where your immune system goes a little rogue and starts detecting things that belong as things that don't. I think there's a lot of environmental factors, DNA, stress, because stress suppresses the immune system. And so if an immune system has been severely stressed for many years, imagine how it can start acting up if it doesn't have anyone monitoring it or anything monitoring it. Asthma is a chronic inflammation in the airways where you can become sensitive to certain things, knowing that your airways contain mast cells. Some people have exercise-induced asthma. Some people have stress or anxiety-induced asthma. Some people have allergy-induced asthma. And they're all going to happen at different times, but basically you have histamine. So something is irritating the airways, and then they release histamine, which closes the bronchial tubes but opens up the blood vessels, and so you get this wheezing sound through your lungs and trouble breathing, depending on how your asthma gets induced. So we've talked a little bit about stress, where in cases of prolonged stress or maybe trauma or something that stresses the immune system to the point that it falls offline, we can expect maybe a long-term chronic illness. Maybe our long-term chronic illness is just luck of the draw. We don't know, but staying as stress-free as possible, or knowing ways to take your stress offline and just bring yourself to a calm area or a place within your mind and your body, can bring your immune system back online and allow it to work correctly. Cancer, we talked about mutating cells, that if your immune system is partly offline because of your stress, or if you're on medications that suppress the immune system, which anyone with an autoimmune disease is going to be on medications that suppress the immune system, they now need to be really careful with their cancer markers in their body. Suppressing and strengthening the immune response. So a little bit here about when we get sick. Did anyone notice in the video that they were glad Holly couldn't find the Tylenol to reduce her, to get rid of her headache because it would reduce her fever? Okay, so when you think about it, if your body is creating the fever, it's creating it so that it can kill the virus. And if we bring the fever down, now there are times when we have to bring a fever down, right? You know, 105 in an adult or higher can cause over 105 in an adult can cause brain damage, and over 106 in a child can cause brain damage. But if you've ever had 103 or 104 fever, it hurts. But the thing we know that is if we reduce the fever, if we have to reduce the fever, we can expect it to come back stronger, because anything you try to suppress in the human body makes it come back stronger. It's the same as when you take an antacid. You know, once you get on antacids, it's really hard to get off, because as soon as you take it off, the rebound effect in our human body is to make more fever, make more pain, make more, because the body doesn't like to be suppressed. But we certainly can't have surgery without painkillers. We certainly can't go past 105 fever without reducing. That would just be stupid. But, you know, 100, 101 fever, allowing it to brew, so to speak, is very strengthening for the immune system, because it's allowing your innate immune system, the one that hasn't been screwed with yet, to actually do its job and keep you down, because your body would really like you to rest. And I know that's an impossible feat for a lot of people, but it would really like you to rest so that it can do its job. And the more we pay attention to that and do self-care, the more we're going to be able to teach that, including self-care. Edema and the heart. So we are on lymph day. So if you have a client that comes in and they're swollen, let's say they have bilateral swelling of their legs, the three questions you need to ask are, do you have heart disease? Do you have kidney disease? Or do you have liver disease? Okay. I know it says edema in the heart, but it's there to help me remember. So the three organs that deal with the fluids of the body, liver, kidneys, and heart, and you got a client that comes in with swelling, and your first thought is, oh, well, gosh, I've had lymph drainage, or I've got circulatory massage. We can just push that fluid right back out of your legs. Well, we have to be educated enough to say to the client, do you know why your feet are swelling? Oh yeah, I'm a waitress, and at the end of the day they swell. By the end of the week it's hard to get it down, but it's been this way for years. And you can ask them, well, your intake form should ask if they have any kind of health condition that would preclude them from getting a massage. So if we talk specifically about the heart, though, the right side of the heart is accepting all the fluid from the veins to take to the lungs to get oxygenated and then come back to the left side of the heart for the systemic circulation. So let's say we have a right-sided heart issue and someone comes in with swollen legs and we push all that fluid right back to the heart, a heart that's weakened and can't take it. Well, we're going to push too much fluid to the lungs, and we could very possibly cause them to get pulmonary edema and drown in their own body fluid. On the left side of the heart, if we're sending fluid back, then there is always the risk of a heart attack. Now, I've only had one client in all my years that had extremely severe heart failure, but his doctor said he could get a back massage, but not legs. And the doctor was very well educated and knew what he was talking about and gave him permission to get his back worked on, just not his legs, because pushing the fluid from the legs, the reason the legs are swollen is because one of the organs can't handle it, or they stand all day long, or they don't eat enough protein, or they've had too much salt. There's many reasons, but your job is to make sure that they don't have heart disease. So should we always decline a client that appears swollen? No, because they might know. They might know if they're swollen because they don't eat enough protein, or, their doctor says they don't eat enough protein, or they're a waitress and they're on their feet all day, or they have lymphedema tarda, which is just a genetic form of lymphedema, or they're, they take medication that makes their ankles swell. As long as they know that, as long as you know that they don't have heart disease, chronic heart disease, if they don't know, then there's nothing you can do. But somebody with extreme heart disease is probably very rarely going to be in your clinic. Okay. So, but it's possible. It's happened to me. It's happened to me, but he came with a doctor's note that said it was okay for him to get massage on his back. So if a client has edema and is on blood pressure medicine, does that automatically preclude them? Should we ask them to get clearance from their doctor? You're always safe if you ask them to get clearance from their doctor. However, if they walk into your clinic or your office, or they're coming through a chiropractor's office, you are protected by that chiropractor. If you work at a spa and they allow them in, you are protected by that spa that should have asked questions. But when they're on blood pressure medication, that means that they don't have high blood pressure. So if somebody answers on your, on an intake, do you have high blood pressure? Yes. And then the next question is, are you on medication? And they say no. Well, then, yeah, I wouldn't touch their legs. I probably wouldn't even give them a massage without their doctor's okay. I would also want to know how high their blood pressure is, because over the last 100 years in our world, we keep bringing safe blood pressure down, where people used to live with 140, 150 over 110 all the time. So, but that's only because I have a nurse friend who helps me with stuff like that. So if you don't have a nurse friend to help you with stuff like that, you just have to be cautious. The question of vaccines is, again, it's a very private decision. The only thing I usually talk about with vaccines is that as a homeopath, we're taught that the childhood illnesses like chickenpox and measles and mumps, not polio, of course, we vaccinate against polio, because we're not stupid. But the philosophy I learned is that childhood illnesses, the reason they're part of childhood is that they help to train the immune system how to function correctly. And that usually after a child has a childhood illness, there's some sort of a growth spurt, whether it's mental, emotional, or physical. And within the homeopathy world, we look at that very seriously and really make informed decisions about whether we're going to put, 70 vaccines in our body. Okay, so when I was a kid, we got a polio vaccine and a smallpox vaccine. That's it. Now, before a child's even a year old, they've had 50 to 70 vaccinations put into their body. And it's a different world. We, as a homeopath, we wonder how much it's skewing their immune system, how much it's skewing them, how many allergies it might be bringing, how much eczema or psoriasis could be bringing, because if the body is out of balance, then it expresses on the skin. So there's hepatitis. And so, vaccines, again, are very, very personal. And I cannot say what I would do if I went back to being a mom, but my kids didn't get a chickenpox vaccine. They didn't have it. They probably got MMR, mumps, measles, and rubella, and they got whooping cough, diphtheria, and tetanus. Those were the common vaccines when my kids were little. But now they just vaccinate for everything. So, when a person comes to me for homeopathic treatment, the best advice I can give is just wait if you can, or research waiting until their immune system has developed on its own for 4 or 5 years before they go to school. And then consider the vaccines again. But, that's a really, really hard decision when the mainstream medical is bullying you to get vaccinations. So it's a very, and now we have COVID. And of course, I got a COVID vaccine because I had an infant in my house, and I had a husband with cancer. So my body was healthy enough to receive a vaccine. As far as I'm concerned, I was healthy enough to get the vaccine. So I considered the vaccine part of my responsibility because I'm not an overly vaccinated person. I've never had a flu shot. And so I made the decision based on that. Some people would make the decision just based on science and get the vaccine. Other people didn't get the vaccine. And of course, we know that it caused a lot of rift in the world and whatever. So, and the last thing here is psychoneuroimmunology. Just write the word down, or it's already on there, and you can Google it yourself. It's about the mind-body connection and illness. So psycho meaning mind, neuro meaning the brain. It should say endocrine immunology, because it's all about the connection between the hypothalamus, the thalamus, and the hypothalamus, the pituitary gland, and the adrenal glands. It's called the HPA axis, and it's all about how stress and different triggers work to support or suppress your immune system. It's a pretty new study, probably the last 25 years, and I think you'll find it very interesting if that's the kind of stuff that you're into. So massage in the lymphatic system. So we have heard from me that we can increase the flow of lymph. We can get the lymphangions to increase their beating somewhat more, maybe 10, 12 times a minute. But we also know that manual lymphatic drainage, we can get them moving at 25 times a minute. So really, really successfully moving lymph. But what we haven't talked about yet today is since we've had HIV and AIDS on the planet, and you know, there's always a positive in everything that happens on the planet. And when HIV first hit the planet in the mainstream knowledge of the medical field, we didn't know what we know today about lymph. We just didn't know, because we just didn't, it was just like a subset of the circulatory system. But because we have this virus that attacks the helper T cell, and it enters the T cell, and when the T cell divides, it contains the HIV virus in both T cells. Well, we had to really take a look at that. We had to really, really, really look at that. And what we had to learn about the lymphatic system, T cells, B cells, phagocytes, and macrophages. And so, because T cell counts are probably the most important thing to a patient with AIDS, once they've gone into AIDS, the T cell counts is extremely important, because that's where it judges the level of their health, is their T cell count. So studies were actually done on people with active AIDS, and massages were done, and their T cell counts were taken before and after the massages. And there is scientific proof that shows that massage increases your T cell count, especially your T4 helper cells, which are ultimately in charge of and the functioning of your immune system. So every time you're giving a massage, you are strengthening someone's immune system. Okay, we just know that through lots of studies. And so I think that's one of the most important things we can learn, besides moving the lymph, cleaning the lymph, putting people in parasympathetic nervous system, is that we actually, through relaxing them, increase their T cell counts. So I think that's just an amazing effect of massage. Okay, so this is the last slide. I already have ABMP open to end our day. And we're gonna go, I'm gonna look at my progress just in case and see if any questions need to be, bring back 7. You wanna do this periodically to your own. Lots of teachers can tend to use this. And so I always wanna check. So I'm gonna go back to Exam Coach, go to the study checks, And I'm going to go to anatomy and physiology. And I'm going to look at the lymphatic. So we have lymphatic and immune. So you can look at both. We're going to take a quiz. Now, I don't have anybody on here helping me right now. So it'd be great if you could answer as quickly as possible. How many sets of tonsils are in the body? Didn't even talk about it, but who can take a guess? 2 sets? No. There is no 1. So let's go to 3. Okay, so your adenoids are actually tonsils for your nose. So your adenoids are in that count of tonsils. Where are the lymph vessels which carry lymph to and immediately from the lymph nodes? What are the lymph vessels which carry lymph to and immediately from lymph nodes? Yeah, I like D myself. Primary. Remember, the capillaries are only at the beginning of the circulation, so primary lymph vessels look like the best answer to me as well. Once a person has chickenpox, he is considered immune to it, to acquiring it in the future. This type of immunity is known as, most of you are saying A, so active, naturally acquired immunity. We'll start there. That is correct. So active meaning you got the disease and you naturally acquired that immunity. The movement of lymph is facilitated by skeletal muscles and what kind of pressure? Passive means that it's not active. It's just, it's not happening in an active way. Okay, so we have lots of different answers here. Diastolic and systolic have to do with your blood pressure. So I think it's going to be B or C. So a lot of people are saying B, so I'm going to pick B. Nope. Osmotic. So osmotic pressure for lymph movement. The lymph node is the main residence for what? Do you think it's leukocytes or lymphocytes? Yeah, I'm with you guys. Lymphocytes, which are the T and B cells. So Ruby is mentioning that Osmosis Jones is the movie that she knew that it was osmotic pressure. You know what? Some movies are really fun like that. Lymphocytes are produced in bone marrow and where else? So yeah, let's go with thymus. Lymph drainage from the feet, legs, and gluteal region passes through the, so lymph, feet, and gluteal. Feet, legs, and gluteal. Good. Most people are saying inguinal. Excellent. Which of the following is not part of the lymphatic system? Good, you're all putting D. Those are your tear ducts. Your lacrimal ducts are your tear ducts. Lymphoid tissue located in the submucosa of the intestines. You know what? I did not tell you the name of those, so this is going to be a guess for most of you. This is the intestinal. Yeah, most of you are guessing D, and you would be correct. Peyer's patches. Good job. Well, you may not have been guessing. You might have just known. Masses of lymphatic tissue that are located in a ring at the back of the mouth and throat and protect against bacterial invasion. All right, everybody is saying tonsils. Excellent. All right. Okay, let's look at the immune system, see how different those questions are. Antibodies are produced mainly by B cells. Good job. Remember, the B cells give birth to daughter cells, the daughter or the plasma cells, and they make the antibodies. Cells that retain a record of a particular antigen for a fast immune response are called what? Yep, you're all saying A for cell. Good job. A red superficial rash of welts is called what? Does anybody know the medical term for hives? I like that. I don't know. Crystal, yes. Not at all. That's okay. Good, Carolyn. Because you have it. Urticaria. So have you ever been poisoned by a stinging nettle bush? How it creates a rash? It gets its name from urticaria. Urticaria urens is stinging nettle. The body's defense mechanisms protect us from what? Everybody is saying C, so that's what we'll pick. Cells derived from bone marrow that ingest and digest foreign cells or particles. Well, look at you guys go. Phagocytes. You guys are answering so fast. You're making this so easy. When we are able to resist threats to our health and survival, we are. When we are able to resist threats to our health and survival, everyone is saying, hey, we are immune. Thank you. What is a cell that engulfs cell debris? I think we just had this. Oh, engulfs it, yes. Good, everyone is saying macrophage. You guys are quite on it today. What do the body's defense mechanisms protect us from? Good. Foreign tissue cells. A mechanism that ensures protection against certain types of threatening organisms or toxic materials. This is a mechanism of your immune system. Most everyone is saying inflammatory response, but it is not right for some reason. A mechanism that ensures protection. Most everyone is saying D, so specific immunity. I would have picked inflammatory, but maybe because it said specific. No, a mechanism that ensures protection. I guess it would be specific immunity. A disease in which the human system attacks normal tissues. Good. So immune. All right, let's see. We have 4 minutes. Let's go back to study subjects. We'll go to pathology real quick. And we'll check. And here we have lymphatic and immune together. A general term referring to a chronic inflammatory autoimmune disorder that may affect many organ systems, including the skin, joints, and internal organs. So I believe this is going to be, yep, I think you're all right. Lupus, this is what my niece has that I just went up to see. Yeah, very, very terrible disease. Oh, what happened? Oh, I guess it skipped. Oh, maybe the person who took the quiz before us didn't finish. And so it went, well, that's okay. I'm just gonna, you know what, you guys have been awesome today. So I'm going to let you go. And thank you so much for hanging in there with me today. I hope you all had a good time learning about lymph. Maybe Mindy will, you guys all have a great night too. Thank you, thank you. You're very welcome. Have a good rest of your day too. And I'll see you guys next Sunday for digestion. I'll see a couple of you tomorrow. Thank you all for signing off. It's very helpful. Corey, yes, the next anatomy class starts September 20th, and it's Tuesday and Thursday from 9 to 3. September 20th, it should be in the calendar, and it starts just in a couple of weeks. September 20th to November 17th, Tuesday, Thursday day, 9 to 3. Excellent, you do that. All right, we just have 4 people left to sign out. Looks like Isaac's is offline. Lupe, David, and Isaac need to sign out. David, are you there? How about Lupe? Lupe and David, class is over. I need you to sign out. Oh.